All right. Good morning, everybody. Can we still say Happy New Year? We haven't seen you guys, so I'm saying Happy New Year. Hope this is um, a great year for everybody and much better than last year, that's for sure. Very exciting day yesterday. I think we're off to a very good start. But good morning, and I want to thank you for joining us this morning. I see we've got over 100 people, so this is great. I want to start first by saying, I hope that each of you and your families have remained safe during this difficult time. I'm hopeful that 2021 will bring us light at the end of the tunnel. I mean, people are starting to get the vaccine, so this is good. And at United Way, we are very grateful for you and the tremendous work that you carry out each day, keeping families safe, housed, fed, and with access to education. These are the important things. The pandemic has demonstrated how vital each of your organizations are and will be in the year to come as we rebuild and continue to support and provide for our families who have been affected by COVID. So I want to thank the Volunteer Generation Fund and Ulster Savings Bank Foundation and Duncan Joy Foundation for their sponsorship, and to the Dutchess County Workforce Investment Board for their continued partnership. We can't do these things without support of our sponsors, so thank you so much. I'm very proud to work in this community. This community is caring, compassionate, and they work together to help every member of our community. So from the bottom of my heart, I want to say thank you to all of you. You all bring something so vitally important to our community. Today, we are going to be covering some very important topics. As an organization, we have been reflecting on how we can be better and more committed to the principles of diversity, equity, and inclusion. And as a result, we continue to offer workshops around how our community has been specifically affected by systemic racism and inequity, and how we can work together to provide equal access for all. So building on our previous work, I'm grateful that we have community experts that will provide content in how each of us can utilize anti-racist principles in our organizational and daily lives. And additionally, we know that keeping our volunteer programs robust and active has been a challenge, as public health has forced us to conduct out every day virtually, as we are today. Fortunately, we will discuss the ways in which organizations can better connect, engage, and retain volunteers for when we do go back to a more traditional work model. So additionally, we are thrilled to announce, and this is a new announcement, it's a new partnership with the Dutchess County government around eviction prevention. And I'm sorry, it's only for Dutchess at this time. So as the looming housing crisis begins and residents seek much needed financial resources to remain safely housed, Hudson Valley 211 is going to be there 24/7, 365 days with human-centered support and referrals to agencies that have current eviction prevention financial resources. So, and additionally, Hudson Valley 211 will provide updates and education around how agencies can best utilize 211 to promote their programs and initiatives and ensure that the community is better connected to your incredible work. So lastly, United Way will conduct our mandatory agency meeting. So if you are going for funding, you need to make sure that you put your name and your organization in the chat box. We don't want to miss anybody. So if you've just come on, name and organization, we're calculating them. We've got people there making sure that we capture every single one of you. But the agency meeting for those applying for United Way funding under health, education, financial stability, and veterans needs. And we continue to provide resources to the most pressing challenges that our community has, especially that have been exacerbated by this pandemic. So I want to thank my team. Can't do this without my team, this wonderful team. I'm very fortunate that is headed by Melissa Clark, Senior Director of Community Impact. And I think I saw Rebecca Lull, who is amazing. And if you don't know Rebecca, you should, because she's the one who keeps all the stuff rolling in the background. And I think I saw our Vistas on, Christy, Peter, and Yaya. Yep. So welcome to them. Did I miss anyone, Melissa, of our team?
Just Emily Darrow, who's also...
Emily Darrow, yes, Emily Darrow. So if you don't know her, she's Senior Director of Marketing, and she's the one who keeps this going. A lot of pressure for Zoom meetings. I'm sure you can all imagine. You know, I just had to throw one of my dogs upstairs because I'm like, she just kept barking. So we always cross our fingers that Zoom works, internet works, and dogs aren't barking. So, but I want to thank my wonderful team. So far, we have a little over 100 of you, and just want to make sure that you feel free to ask questions and everything. And I want to thank our speakers today, Linny, Babette, and Tracy, for your time with us. Thank you so much. They are leaders in their field, and they are encouraging questions and conversations about these important topics. And with that, I'm going to turn it over to Kevin Cleary. I know I saw space over there. Yes, there he is. Kevin is the chair of the United Way board. So take it away, Kevin.
Well, good morning, and I'll say Happy New Year as well. Thank you all for joining us here this morning. I've had the opportunity to meet many of you, so it's good to see a smiling face here so early in the morning. I just wanted to echo what Jeannie said and just say thank you to all of you for being partners with the United Way, but more importantly, thank you for the work you do in the community, the compassion that you have, the real desire to kind of help those in need in the community. It's just extraordinary. And I know you probably don't hear this enough, but let me just say on behalf of the leadership team of the United Way, we are really pleased to be partnering with you. And our job is to help facilitate your great work in the community. We're the fundraisers, if you will, right? And then Jeannie and the team kind of with our community partners and volunteers review those funding requests that you have and allocate the funds out. It's just a really extraordinary piece of work. And I just wanted to say on behalf of the United Way board, a huge thank you for everything that you guys do in our community. I'll tell you, this has been an extraordinary year, and there is a light at the end of the tunnel, but not next week, right? We're going to have to continue to operate in this virtual world through at least, I'm saying maybe perhaps through all of 2021, right? But there is vaccines are being stocked and administered by the local hospitals and the public health organizations. So there is light at the end of the tunnel. I'd ask you to please continue to encourage your staff and community members to wear a mask and to socially distance. That's how we're going to beat this virus, guys. And we really need everyone's help working together to do that. And looks like we'll get some good leadership from the federal level now with President Biden. And I just ask that, we all just continue to work together here as we work through this year. But it's really an honor to be the chair of this board, working with Jeannie and her extraordinary team. And I think each and every one of you are an extension of the United Way. So in a sense, I really enjoy the partnership, having met many of you and actually seen the great work your organizations do in the community. It's truly inspiring. So thank you, guys. And Melissa, thank you for pulling this group together. And Jeannie, thanks again for your leadership and that of the entire team. Thank you, guys.
Thank you so much to our board chair, Kevin Cleary, for joining us. I know how busy you are, so really appreciate your time and getting a chance to meet everybody. And like I mentioned, please put your name and organization. Chat box will be very important. Now it is my great honor to introduce Lenny Jacob, Senior Vice President of 211 Hudson Valley. Lenny Jacob was born in India and immigrated to the USA in 1994. Ms. Jacob earned a bachelor's degree in computer science from Lehman College As Vice President for 211 Hudson Valley Region, Ms. Jacobs brings a wealth of knowledge and experience in the fields of information and referral services and databases. Lenny joined 211 in 2004 as a resource manager, and since 2015, she oversees all aspects of United Way's 211 for the Hudson Valley region, a crucial information and referral service which meets New Yorkers wherever and whenever they need it, empowering them to secure a brighter future. So without further ado, I'm going to mute myself and turn it over to Lenny for our first presentation. Welcome, Lenny.
Thank you, Melissa. Thank you, United Way Duchess team. Thank you so much for having me here. You just heard, my name is Lenny Jacob. I am the Senior VP of 211 Hudson Valley region. I have to say it, I am so excited to be part of today's community united meeting. Yes, we are united to make that change. Before I get into 211, I just want to share how my life is connected with the 211. As Melissa just mentioned, my family migrated from India in late 90s. During that time, I can promise you this, there was no centralized information system in many states, including New York. Like any other Indian parent, I'm sure my parents wanted me to get into medical field, like my siblings, they are, and my extended families, they all into medical field. But I was interested in the computer field, which they agreed. I'm happy for that. I joined United Way right after my graduation. At that time, my goal was, stay with the United Way for 5 years, learn as much as I can, then run with it. I am still here with the 211. This 211 program changed me as a person, how I look at things in life and what appreciate, what I have in life and not complain about what I don't have in life. Because you know what, the type of calls we are handling, when we get calls like people looking for food, we get calls about people looking for a place to stay, it changed me. And I will say, sometimes it's very shocking to see, when I run the report, the needs in the community, especially when you get calls from affluent communities, people looking for food. So that is my connection with the 211. So let me get into the 211 world. So what is 211? United Way's 211, it's a helpline which offers health and human services, information, referral, assessment, and crisis support to help callers find services they need. Melissa, I don't see the slide. Do you have the slide?
Yes,
open?
yes.
Okay.
We're just going to have actually Emily Darrow click through. So just give us 10 more seconds.
Okay, no problem.
Thank you.
No, as she's going to display that slides, I can talk a little bit more about 211. So 211, we provide health and human service information. It is an easy to remember telephone number. One of the only, it used to be 8 N11 numbers. Now it's a 9 N11 number. 211 is one of the 3-digit number, right? In 2000, FCC designated 211 to improve access to health and human services via information and referral, or you can call it as information and assistance. And we operated by national standard. When I say national standard, this national standard is set by an entity called AIRS. It is abbreviation of Alliance of Information Referral System. This entity formed in early 90s. They set standards of how to run a call center, how to handle a call, how to maintain the database, how to handle mental health type of calls, how to manage, the resources for a targeted group like seniors, how do you handle calls when you get from veterans. So it's not even just for the 211 world, they set standards for any information and referral field targeted to specific group as well. And in New York State, 211 in New York State is designated based on regional basis. Emily, I believe that is the third slide. No, second slide. Second slide. Okay, I got it. Okay, so 211 New York State is designated based on regional basis. We have in New York State, we have 10 regions and 7 call centers, and it is available across the nation. We are open 24/7. And also, you know, we work very closely with the emergency management so that OEM, you know, emergency management can potentially activate 211 as the point to handle disaster calls. And that's a perfect example, like during this COVID, you know, since March, like when it happened, Dutchess and Rockland, Westchester, Putnam, and a portion of the time for Sullivan County, OEM activated us, you know, our 211 to be the point of entry to offer COVID-related services. So we work very closely with the emergency management. You know, as you can see, 211 is more than just a number. Its essential component includes contact center, the database, searchable website, and also it's include, you know, we can produce data and the report. If you move to the, okay, you have it there. Our 211 Hudson Valley region covers 24 counties. Like I was telling you before, we have 10 regions and 7 call centers. Our call center, one call center handle calls for 4 regions, 7 counties in the Hudson Valley region, 2 counties in Long Island, 12 counties in Capital region, and 3 counties in Adirondack region. So it's outside of Hudson Valley, we handle 17 additional counties, which reaches a total population of 5.2 million people. So you may wonder, you know, who calls 211? Anyone looking for health and human service. That can be different departments in the county, Office for the Emergency Management, Department of Social Services, individual, you know, those are looking for services, and also community-based agencies. If they have a client sitting there, if they need information, they can dial 211, which they've been using it. So what I'm going to do now is I'm going to share my screen to do a live demo on what's happening in the call center now as we speak. So give me a second. Just going to share my screen. Melissa, okay. I'm just going to take that. Okay. Emily or Melissa, can you tell me you can see my call center dashboard? Can you confirm, one of you?
Yes.
Yes.
Perfect, perfect. Okay. So what you're seeing on the screen now is our phone system. Okay. Both our phone system and the database, both are integrated. So any information you capture in the phone system, it is automatically captured, transferred to the database. You know, both are web-based because the database and the phone system, which means staff can work remotely. And this set of us, I will say, super, super helpful during the peak of COVID. And this dashboard displays, you know, you can see it, how many staff logged into the system, what type of contract calls we are handling, how long is the wait time, and what's the service level, or is there any crisis call pending here? So I'm going to spend a little time explaining what it is, you know, what kind of experience, you know, people get when they dial 211. So when a person dials 211, the first message they hear, you know, after the greeting, the language option, we purposely put that option out there because, we don't want to turn anyone away due to their language barrier. We also have bilingual staff. We also have a translation services offer 200 language. Oftentimes we utilize their service as well. After the language option, they're going to hear menu option. It's like a phone branch. Like, if you're calling about basic needs such as food, shelter, press X this option. If you're calling about veteran services, press X option. So there's a multiple options right after the language. Depending on, which language is selected, they go into here. There's one in English and also there is in Spanish. Then they have an option for other languages, right? So what you're looking at right here, I have 2 staff logged into the system. You can see it's all color coded. You can see what type of contract call they're handling. This list actually tells us the type of calls in queue, or what kind of option the public pressed. So this IVR, this phone system is IVR based, which means it's a skill based. Skill can be a language, skill can be a contract, skill can be a program. So we have a flexibility of setting that up. So if you look at right here, we have, since we manage calls from Northeast, you can see we have 3 calls from Northeast. There's a call from Long Island right now. This is a live dashboard, so the information is going to change as we speak. Also, you can see here, so in addition to the 211 core services, we also handle contract-based calls. For example, we have a contract related to veterans, which include support services for veterans who are homeless or who are at risk of homeless. That's for the Hudson Valley region. So 211 is not only an entry point, but the team also takes on the role of case management. We also have a system in place of crisis calls for Putnam crisis contract, like right here. So what's going to happen is, if we get a crisis call, it will jump the queue. When I say jump the queue, it actually, if all staff is handling calls, while they're on a call, they actually get a warning saying there is a crisis call waiting, right? And it's kind of like a marquee. If they don't answer within minute, within 60 seconds, we as a management, we get a notification saying you have a crisis call waiting, no one answered. So there is already a system in place for crisis calls to jump the queue. So the system allows us to prioritize, based on the contract expectation or the type of calls. You can see here service level, like of course in the morning, the wait time is going to be a little longer because you start with the less staff, 8 o'clock. So staff work in a different shift. There's one person at 8 o'clock, then more people joining at 9 o'clock. There's another person at 10 o'clock. So depending on, when you look at the service level, this is going to changes, all the time. So what's going to next, as Jeannie mentioned, 211 is going to play as the entry point of a Dutchess eviction prevention program. So what's going to happen in the phone system for that project is we're going to create a campaign right here, right? That is a skill. Then what's going to happen is that skill is associated to the staff. And when the public, when they press that option, of course, the staff is going to greet the caller accordingly. We may be saying, we don't have the exact verbiage yet, we may be saying, thank you for calling Dutchess County Prevention Program, how may I help you? So we can change the greeting based on, the option the person picked on. So that's specific to that program. So we have the flexibility of changing this piece. So this program should start February 1st. So we're going to work together as a team just to see how we can help the community out. After the, the public press this option, what's going to happen is staff can greet the caller based on the contract. I will say a typical call most of the time it's a 5 to 10 minutes. Sometimes it can be 20, 25 minutes, depending on the situation of the caller. We will ask how we can help the caller, then we assess the situation. We also confirm the zip code with, so that we can refer callers to programs and agencies located in their community. So, oftentimes when we look at it, the service eligibility varies, right? Sometimes the service offered to specific zip code, or maybe people with a certain income. Also, the intake procedure can be, you need a denial letter from DSS, or you need a referral from a community agency. So we have all those details in the system. So depending on the person's need, we read through, the staff read through all the details about that agency. If the referral seems appropriate, we will provide that information to the caller and save the call with the service need, demographic, and other information. The standard for providing services is, we always tell them, please always call us back if the information we provide us, if it is not useful, if it's not helpful, if you need more help, please call us back. We are here 24/7. And I have to say this, many times callers, remain anonymous. They don't want to provide their personal information. I can see from my culture, came from India. My culture is usually, when you go through financial struggle and other struggles in life, you don't want to share with the other people. You don't want anyone to know, I need help with the utility payments. Oftentimes you don't share your information. So that's the same thing when people call 211, they always remain anonymous, but we can always, collect their name, contact information, if the caller permits us to do so, which can be important, if we have a concern about whether the caller can access services without an advocate. We can also schedule follow-ups, with a plan, with a note about purpose of the follow-up, the scheduled date and time. When do we do that? Sometimes when we get calls like from seniors or at-risk people or in crisis, saying, if the senior is saying, my EBT is not working, I'm trying to reach my caseworker, no one is picking my phone. If we sense there is an urgency for it, we always do a conference call with the case manager with the caller's permission and try to see what's happening. So cases like that, if we see that there is a follow-up needed for that crisis or urgent need services, we always schedule follow-up. And I will say this, oftentimes I'll say 99%, when we do a follow-up, people are so happy that, someone is thinking about them, someone, we want to make sure that they receive the service, what they were looking for. And I will say, we do get 911 emergency call. If that happens, we are able to call the callers county 911 emergency services from our phone system. I will say this, with our 211, we do have a MOU with all the emergency management, all the 911s. Because of that, we have an access to emergency management, their backup number, so we can dial, and so we have that relationship. And I will say, some of you wonder, Lenny, are you able to give information to all calls coming into the center? Honestly, sometimes we don't have information for some of the calls. We call it as a gap in service. For those times when we discover gap in service, we can record that and report back to the community planners and who are making decision as to how to best use resources to meet the needs of the community. For example, why there's a gap in service may not be available because the caller is not eligible for the program, or the caller may say, you know what, I tried all these XYZ agencies. I don't want to call them anymore. Just give me another agency. Sometimes, the service may be far away. They don't have a transportation available, so they will not be able to get the service what they're looking for. So there's many reasons why there's a gap in service. And, I want to share an example, a true call happened in March. This call, it was from Westchester County. This was a family, mother with the 2 children and husband. They were in a shelter care system, in and out, even before COVID. So because they're in a shelter care system, they need to get out from shelter during daytime. So during COVID in March, the temperature is down, it's cold. The shelter, the management said, you need to leave the building. And so they called us, and having 2 small children, especially with this crisis going on, what we did was we reached out to our local DSS and the health department, shared the situation. And I will say, our DSS was able to expand the shelter services for 24/7 for a period of time. The reason I shared this with you is we as a community, we need to work together to make that change. No, 211 cannot do alone to help a person out. Service providers like you, we need to work together to help individuals out. I know we can. Emily, I'm going to stop sharing my screen so we can go back to the slide, if you don't mind, to make that accessible. Perfect. If you can go to the next slide. Let me see. After that. One more. Yes. Okay. So you can see it from the screen. Regarding the call data, the 211 system is able to generate useful data, including number of calls handled, why they called 211, which zip code they are calling from. Do we see a trend in specific need in the community? Or if there is an unmet need, we can generate all those reports based on the calls coming into the center, because when the staff talk to the person, they are capturing all this information from the caller. So you can see it in 2020 alone. Last year, we handled over 75,000 calls from the Hudson Valley region. I have to say, that 75,000 we are talking about, if I compare with the 2019, it's doubled. It was more than 50% in last year. Out of that 75, we got almost 10,000 calls from Dutchess County. Let me see. Okay, perfect. So you can see from the slide, can you move the top 5 zip codes? You can see that's a Poughkeepsie, Wappinger Falls, Beacon, Hyde Park. What are the top 10 zip codes we are getting calls from? And I will say, these are clients like Mark, who called 211 because he had thoughts of suicide and didn't know where to turn. Or Joy, who called because her SNAP benefits were deactivated and she didn't know who to call. Or Susan, who is immune compromised and called during the height of pandemic because she was eating her service dog's food to take her medication because she couldn't go out to shop. So you can see, what type of calls we are getting, how we are helping the individuals out. And we are able to help those individuals out because service providers like you are out in the community and providing that direct service. Move to the next slide. Okay, so from this slide, you can see the top service needs from Dutchess County in 2020 alone. So the green one, it's financial. People looking for financial assistance. I can tell you that's more mainly connected with the rent payment assistance. you can see the blue and the pink, which is housing and utility assistance, and also health. Yeah, health also last year was higher. It's mainly because of COVID. You know, when this crisis happened, people were calling 211 about where can I go and get tested, like I have symptoms, so what do I do with it? I'm trying to reach my doctor, he's not returning my call. So there were like increase in costs connecting health. So the first is financial, then you can see utility, housing, help, and health go hand in hand. Then also we did see increase in food. People were looking for food assistance. I will say, because of this COVID, some of the food pantries were not able to operate. Sometimes we had only one or two agencies, we can always refer people to. We did see an increase in food. So this chart give you an idea on the type of calls we were handling from Dutchess County. Let's go to the next one. Okay. So, in addition to handling calls, I talked about how we are handling calls, the type of calls coming in, and also what are the needs, information like that. So in order for staff to provide information, we need to have updated resources, right? So updated resources is one of the key element of 211 service. We have over 17,000 programs in the system. One of the national standard, as I mentioned earlier, is we supposed to update all information once a year. As you could imagine, during this COVID time, the information was changing rapidly. I think we were in contact with the agencies multiple times. And what I want to share with you is how people can reach 211. There's three ways they can reach us. A, they can dial 211. You as a service provider, one thing I want to point is sometimes in business, like as an organization, the phone is not set up to dial 211. I meant the N11 number. So because of that, we also have a 800 toll-free number, which is 800-899-1479. We can actually put it in the chat so you can see it. So the easy way is by dialing 211, but the phone setup can also change to allow the N11 dialing, which is 211. That's one way to reach us. The second way is you can also reach us by texting. If you text your zip code to 898-211, you're going to reach us. So this is a 898-211 is a national texting code for 211. So the zip code you're putting, if it's a 10705, the system is going to recognize which region it linked to, then we going to get that text. So people can also reach us by texting, which is 898-211. You can also search our website. Our website is 211hudsonvalley.org. Emily, can you move to the next? So there's multiple ways, you can reach us. We are available 24/7 by dialing 211. You can reach us by text. That also, the texting is limited hours. That's a Monday through Friday, but you can always call us, which is 24/7. So our website is displayed here. You can see it. That's at 211hudsonvalley.org. Move to the next one, Emily. Okay, you can also contact us as a service provider, just to make sure whether your information is listed in our 211 system. You can click on it. There's information right there. You can email. You can also, reach me directly if you want to make sure that your information is listed in the database, and also make sure that, we have up-to-date information. So, my ask is, like, as a service provider, please, use 211. If you're looking information for your clients, you can reach us by dialing 211. And lastly, we want your help. You can help us by making sure your information is listed in the 211 database is up to date. I'm going to stop here unless anyone has any questions. I want to say this, if you'd like to know more about 211, please don't hesitate to contact me directly, or you can dial 211.
Thank you,
Melissa,
Lenny. Yes, we do actually have a few questions.
go for it.
Yeah, so one was, does 211 utilize volunteers?
We use volunteers for disaster time to manage costs. For our regular operation, we have paid staff. We don't use volunteers.
Thank you. Great. And one agency was wondering, they help with a lot of mental health crisis. If there's any way that they could collaborate around those that call them in mental health crisis.
That's a great question, great information as well. Absolutely. We definitely can take a look into it and see, whether we have even all mental health service information in the system as well. Definitely we can collaborate. And this way we can make it easier for the public, the individuals, those are looking for information. We can, it's just that one number they can call and get information.
Great. Yes. And another organization was asking how they submit their updates to you.
You can contact us via email. That was info@211. I'll tell you right now. If you can put it on the chat box, Melissa. It's a 211 info@hudson211.org. That is 211 info@hudson211.org.
Excellent. I will put that in momentarily. We also had a question, are there other websites for other regions of New York State outside of the Hudson Valley?
The easiest way is you can go to 211newyorkstate.org. It actually lists all regions in New York State. From that homepage, you can click on by county or even by region.
Great. Is there a way for organizations to add your organization to their websites?
Oh, I would love to. Absolutely, absolutely. We can send a logo, and maybe you're talking about adding the information on their website, correct?
Yeah, so folks can know about 211 that go on their website.
Yes, we can give a logo, clickable logo, and it will take, users to our website or, vice versa.
Great. And that's all I have for the moment. Does anyone have more questions for Lenny? It's such an informative presentation. And I know most of you hopefully know about 211, but if you don't, that's okay. Now is the time to learn. So does anyone have any questions? I don't think we got a chance to cover it, but it is at 24/7, 365. So, always very important. One person asked who to contact about that logo. So maybe Lenny, you could put your email in the chat box.
Absolutely, I will do that.
Somebody else asked if the logo would work on a Facebook page.
Yes, we can. Yeah.
Excellent, excellent. And I'm going to put that email in just a second as well that I spoke about. Does anyone else have any questions for Lenny? We have some comments on just how great this resource is to spread the word in the community. And did the question about how to update agency info get answered? Yes, so you're going to be able to send your information, your updates on different initiatives and things like that to 211info@hudson211.org, which I'm going to put in the chat box in just a second. But I just wanted to, before I do that, I just wanted to see if there were more questions for Lenny while we have her attention. Yes, Linda Eddy says that 211 has a great team. Absolutely. Can't say that enough.
Thank you, Linda.
Anyone new to 211 and would like some more information? Now is your time to ask. Okay, great. Lenny, I'll turn it back to you.
Am I on mute now? Okay. Melissa, okay. This is it from the 211 end. I just want to say thank you for listening. And, you know, all I just want to say at this point is please make sure your information is up to date with our system, because, you know, we always want to make sure that we are providing, you know, right information to the callers. And that way, you know, we are also putting correct information of your agency with the callers. Thank you all.
Lenny, thank you so much. That was so informative. And it's such a great resource. Yep, people are applauding. Yay.
Thank you.
But we have a great partnership with Lenny and her team. So I can't thank you enough.
Thank you so much, Lenny. That was incredible as always. You're such a wealth of information. We're so appreciative. I always learn so much hearing from you, and it was really great to see the dashboard and really see the inner workings of how it all happens. And for those of you that don't know, you can call 211 for just about anything. And, you know, hearing some of those examples, especially during the pandemic, was really moving. So thank you, Lenny, so much for your time with us. We're actually running a few minutes ahead of schedule. So instead of a 2-minute break, I'm going to give you a 10-minute break. So feel free to refresh your coffee or tea and get ready to learn. We have another dynamic presentation coming up in 10 minutes. Thank you. Babette, you all set?
I am ready, and I'm going to start right off by jumping on some things that Lenny said, so I'm really ready to go.
All right, excellent. Well, let me just quickly introduce Babette for those of you that don't know her. Many of you have heard from her before. It is always a pleasure to welcome back Babette Baker to our community. Babette is an affiliate consultant at Support Center and principal at Paideia PM, which she launched in 2013. Ms. Baker has over 30 years of experience supporting nonprofits, businesses, and municipalities in program design and development, process facilitation, grants administration, fiscal management, marketing, and program assessment evaluation as a consultant and nonprofit professional. Is there anything she can't do? She has also held roles from coordinator to executive director in nonprofit agencies, municipalities, and community-based organizations across the country. Thank you, Babette. We need our volunteers. They are the foundation of all of the wonderful organizations that are represented here today. So I will turn it over to you and we'll get started. Thank you.
Thank you. I am so excited to be here, and I will say that I always miss being in the room with folks very much. So I think this is my 3rd or 4th time presenting for you guys, Melissa. So I don't know when you're going to get tired of me, but okay. Yeah, we'll figure it out. So I'm just going to add a little bit more to my bio real quick. So I just counted, and I'm like now up to like over 35 years, which is really scary. And what I can tell you is that I started off as a grant writer in the field. And what I always heard from organizations was, you know, we need money, we need money, we need money. Can you write us a grant? And then often when I got into writing grants for people, as I realized, and you know, we didn't have those words when I started in this field, but there was often issues with organizational capacity, misalignment of resources, and some operational inefficiencies. And I moving away from grant writing more into program design and evaluation, because I realized even if an organization gets the money, you know, are they using it effectively? So the tagline of Paideia actually is identify, execute, and measure, which means we help you identify issues and opportunities. We help you execute a plan, and then we help you measure the impact. And so recently I started moving into some healthcare consulting, which I've been enjoying very much. So I want to jump onto some things that Lenny provided in her presentation. Did anybody catch all the data that Lenny provided in her presentation to you guys? And I am a firm believer in raising your hands, putting stuff in the chat. Melissa has to help me because it's been over 35 years, so it's hard to multitask as much as I used to when I was younger. But, you know, I was listening to Lenny and I was thinking to myself, she was talking about the needs in your community, who was kind of calling in. And I thought, you know, I hope you guys are really listening to that, because as we're continuing to go through this pandemic, you know, what kind of information can like the 211 provide for you guys as you guys are looking at, you know, is the work you still do relevant? You know, where you might find volunteers. How are you assessing the needs in your own community? How can you use this information in grant applications? So I want you guys to make sure that, and Lenny, I don't know if you guys provide any kind of like annual updates or quarterly updates or anything about the information that comes into 211. And I know no personal information, but some of the aggregate data on the type of needs that you're seeing. And if you're not doing that, I would encourage you guys to do so.
We definitely can provide that. I will say this, because of this COVID, with all the calls handling, there was a delay in providing information, but we are back into providing weekly updates to Melissa. She has it, but if any organization looking for what's happening in your community, like why people are calling, don't hesitate, please ask.
Great. So Melissa, you're who's manning my presentation?
I am.
Hi, Emily. Okay. Can we put up the poll?
Sure.
Okay. And I'm going to go to full view because I don't need to see it. Oh, I do want to see the chat though. Okay. So if you guys can answer this poll, what is the role? What is your role in the organization? And then the second question, are you solely responsible for managing volunteers? Come on, I want all of you to jump into this. We have 138 people on the call and I'm only seeing about 87 people. There we go. All right, 37 more of you, come on, there we go, it's moving up, thank you. I always like to kind of know who's in the room so I can make sure that I touch on the things that people are kind of looking for and the things that people need. A lot of management, okay, some board members, okay. All right, Emily, I don't think we're gonna get, oh, no. All right, we're gonna give you guys another like 30 seconds. Okay. Yes, Mary Ellen, yes, we often do wear many hats, including cleaning the bathrooms if we have to. Been there, done that.
That's right, watering the plants, doing the dishes, full service, non-profiting.
There you go, there you go. Okay, cool.
And poll?
Yeah, let's end the poll, yeah. All right, so 64% of you are in management, 25% of you frontline, and 78% of you are not solely responsible for managing volunteers. Interesting. So Emily, thank you. Can we take that down? And while you're taking that down, I just want to say, is Emily, is Ellie from the Culinary Institute of America still on the call? No, she's still on the call.
Yes, I'm still here.
Okay, so my oldest son went to Marist, and my youngest son was accepted at the CIA, but decided to go to Paul Smith's. So I was disappointed, but the Adirondacks are very beautiful, so I'm very happy. Emily, can we take this down, please, ma'am? Get back to the, do I have control, Emily?
Nope, I do, but
Oh,
are you
okay.
not seeing the screen?
I'm sorry,
Are you not seeing your PowerPoint?
but I'm still seeing the, oh, I'm still seeing the poll up. Oh, because I had to click it out myself. This is why you need your grandchildren to come over and be your tech consultants, because that's what they do. So ancient map makers or cartographers used to use phrases like "here there be," because they didn't know what was on the other side of things. And so I've been thinking a lot about this as we've gone into the pandemic, and we're about 10 months in, thinking about, do we know what's on the other side of this, right? And so they would write things like, "here there be sea serpents, here there be monsters, here there be tigers," which is actually also a very famous Stephen King short story. And so although we've known, we personally, as this generation has never been through a pandemic like this, we've gone through natural disasters and economic downturns. But COVID has caused such disruption in such a short amount of time. And I don't know about any of you, but I kind of thought, okay, a few months in, we'll wear a mask, this thing is going to go away. And to hear that like 4 new strains have popped up in the last couple of weeks, and we're not sure if the vaccine is going to be effective against this. And I'm not trying to scare anybody, but what I want us to think about, and as your board, I can't remember his name right now, but the board chair of United Way said at the beginning of this, we're going to probably be living in this virtual world at least until the end of the year, if not a little bit into 2022. So what does that look like for us as we think about how do we engage volunteers and do things new? But some things never change. So Emily, can we go to the next slide? So for those of you who have been to my presentations in the past, I am a huge proponent of planning. I'm a certified nonprofit life cycles consultant. And if you haven't heard of that, Dr. Susan Kinney-Stevens created this methodology about working with nonprofits called Nonprofit Life Cycles. And I'll make sure that when you guys get a copy of this presentation, which is going to be very different from what you see right now, because I have written so many notes and have made so many pivots in this presentation, which I normally do. And I also try to keep track of the chats and everything, because I want to make sure I address people's issues and questions and concerns. So, but one of the things that Dr. Susan Kinney-Stevens talks about is building your capacity. And you build your capacity by planning around these 4 table legs. So management is how you run your programs. Your governance, of course, is your board. Your business model is this type of services and products that you deliver. And your administrative systems are kind of like those back office things that you guys do. So, how strong are your databases? How strong is your accounting system? How are you tracking those kind of things? Those 4 table legs support your programs, and of course, your programs support your mission. And so, by building a culture of planning, not that you can identify everything that's going to happen in your organization, but if you have that capacity in place, you're more likely to be resilient enough to survive the things that you go through. So I really encourage you guys to really think about your capacity and your resiliency. And I also encourage organizations to think about their capacity in terms of, if you want to implement a program or if you want to do something, like for instance, if you want to do a mass mailing to like 20,000, 30,000 people in your community, but you're an organization of 3 staff people, how likely is that's gonna work for you if you don't have the capacity to do that? So when you're thinking about your programming and you're thinking about your services and you think about the things that you do, think about what is our capacity to implement, and to measure our impact around the things that we're doing. So always think about that in the back of your head, okay? And please, I love the chat. Raise your hand for questions. I think Emily and Melissa are kind of helping me monitor all of that. Any questions about capacity equals resiliency? And the other thing that you guys should know about me is that I always believe that the best learning is in the room. Peer learning is so powerful. You guys are actually on the ground doing this stuff every day, day in and day out. So please make sure that you're also sharing information with each other because that's really important. So can we go to the next slide, Emily? Did I ask you guys to do this as a poll or no? Okay, so don't worry. So I just want you to think about, you can put it in the chat. What has your organization done in response to volunteer management during the last couple months? So I did a similar presentation for you guys at the back in, I think it was March or May, Melissa. And we talked about things like, having a volunteer plan, making sure that you looked at your insurance and you looked at if you were going to have to provide PPE for people. And so what kind of things have people done in response to this in the last couple of months? And I would love to, if anybody wants to pipe in, take themselves off mute, raise their hands and say a few things, I would love to do that right now and really interact with you guys. Okay, don't make me talk for 45 minutes by myself, please don't. So Jacqueline raised her hand, yes. And I see Mary Ellen as well. So can we go to Jacqueline first and then Mary Ellen? I think it was Jacqueline Hernandez.
Yes. Are we speaking or are we chatting?
We are chatting. We're having a dialogue, every time conversation.
All right. I just wanted to make sure not to violate the rules.
No rules.
Okay, all right, I love it. So with regards to our organization is purely volunteer. And so our biggest challenge has always been obviously to maintain the volunteer status so that 100% of the money that we raise at this time goes to the needs of the youth that we service in our community. So because of that, we have not had the challenge of the financials, but the financials as far as employees, but with regards to volunteers, because there was so many limitations in what we were able to do in groups. With the youth that our mission with our youth is to provide them with a space for socialization. So COVID is the opposite, the total opposite. And so to be able to meet the needs of our population, we had to be very creative about how we were able to meet safely with the youth. And of course, with the schools being on hybrid and some being totally remote, the mental health of our youth was challenged even more. So, so what we did is we creatively looked for outdoor space to be able to meet with them. We did a lot more of that. And then our volunteers were really based on what we were doing. So if we did a community event, we might have been able to enlist parents or people in the community that were interested in the event, but we did a lot more outreach, community outreach, and we didn't stay indoors. It was more outdoors. Kids were packaging in their homes. We did for the first responders, but we were focused on how do we meet, get them active, get them emotionally and mentally engaged without being a burden. So the volunteers were really the kids. It was, them volunteering to do something. And it was people in the community that got rotated into specific projects they were interested in.
Perfect, thank you. And what's the age group in the upper room?
So we're 13 to 18 years. We do have alumni who then what we do is we recycle our teens. So once they graduate and they go to college, we create an alumni. So we have a whole graduation. We have a ceremonial passing the torch where they go from member to now leader. And so that has also been very helpful in maintaining a volunteer base, because we basically say, we poured into you, now it's time for you to pour into other youth. So they are typically the leaders, and because they're so close in age, it's great because they relate to the youth, they understand, they become like an older mentor to the kids. So that's another way that we've been able to keep our volunteers involved.
Perfect, thank you. And I don't know, for those of you, I want you guys to pay close attention to, once again, because the best learning is in the room. That is such a brilliant retention model, right? Because most organizations say they have an issue with retention. So I think the other person was Mary Ellen. I should be writing these down. She had a question, yeah. She had her hand raised as well.
Good memory. Hello, I'm Mary Ellen.
Mary Ellen.
So at the Artifact, we focus on the arts as a pathway for student empowerment and college and career development. Specifically in terms of volunteers, our biggest challenge was helping get supplies and technology out to our students so that they could kind of pivot with us and continue their learning virtually. Um, we made use of volunteers in helping us to bag up supplies. We made use of volunteers in helping us to sort of conduct outreach to who needed a computer at home to be able to continue their learning. And then also to do some of the deliveries and drop-offs while wearing PPE, of course. But maybe the biggest change caused by COVID in terms of volunteer management was we had to redesign what being an intern looked like. We had a lot of young people who would come into the office getting college credit and then being assistant teachers, or helping to maintain supplies and equipment, just helping things around the office. And all of a sudden, all of their work had to become things that could be conducted virtually. So in a way, it became less hands-on, but we wanted it to still be as meaningful an experience as possible, while also contributing to the well-being of our students. So we began to make more use of interns to pair up virtually with students and sort of just have human conversation time. How's it going? What's hard for you? Do you have any questions about getting into college or what it's like to be a college student? Which many of them did, because the idea of what it means to prepare for college also has changed radically in the last 6 months. And we've had to have a lot of, really emotionally hard conversations with students who are realizing maybe it's in my best interests to postpone trying to apply to college for a year. Do I really want to pay $30,000 to sit in my living room? Or go $30,000 into debt to sit in my living room, which, it's so hard for adults also because we value education so much, but at the same time, we have no idea what we would have done if we were 18 years old and in that decision-making position, what would have seemed like it made sense or not. So there's been a lot to figure out and a lot that we still haven't figured out, but our volunteers have helped us sort of just be in it together with our students, which has meant a lot. So it's a lot less of that dishwashing and plant watering for interns and a lot more of individual virtual mentorship.
Thank you. So, what's really interesting is we do really value education. And so, of course, I'm older, so all of my children are gone, thank goodness. But, I think for parents who are planning to have their children out of the house, they're kind of like, well, we're glad you're here, but So it's very interesting. So I'm glad so the kids are thinking about this, the parents are thinking about this, and you guys have made these pivots to figure out, like, how do we still continue to support, the students that we need to support in this new world. And one of the statistics I had in my presentation for later on, but I'll give it now, is that they're roughly estimating that 30% of people in the US right now are suffering some kind of anxiety and or depression, right? And because what they thought their lives would be are not where they think they would have been right now. And so for all of you who are, doing this work, you're seeing it probably not only with your clients, but even with your staff and in your own families. So I think some of the things that we will talk about today, you can apply both to staff and your own personal lives, because we're going to be talking a lot about connection and things like that. So, as your organization has made these pivots in the past year, how have you guys kind of communicated this both internally to your staff and your board and then externally? So have you been doing more regular updates on your websites, doing more social media posts, more newsletters, that kind of thing? And you guys can either raise your hands or put in the chat.
I don't have the raise your hand thing.
Okay. I don't see your face. So, and what's your first name?
Curtis Simpson from UWDOR.
Okay.
I have probably a very old computer. I'll leave it at that. So, I think for us, we kind of started looking at the numbers earlier and got in front of it. So for us, it was like we were talking about this virtually like in October. You know, we were telling, because we have a good articulation agreement with Vassar, you know, and a lot of their students wanted to intern and volunteer, you know, because some of their classes were canceled. So they were here. So a lot of them were like, well, what are we going to do? So what we did was we kind of looked at, okay, so what do you like to do? And some of it was, okay, so we had an art student or someone that wanted to volunteer and their class canceled. We had 2 art students volunteer with us. And what they did was they did a mural with the kids. And then what we did for them is we told them that they could use that as their portfolio. And we told them, like, you know, we might be going remote going in January. So let us know what you wanted to do. This way that they was able to fix their schedules up and not believe that they were going to come right back. You know, so we got in front of it. You know, we send a lot of emails. I think social media at this point is like one of the best ways to get in contact with especially volunteers and interns, because that's it right now. That's really the lifeline for everything right now.
Curtis, what's the name of your organization?
Youth Services is I work with Family Services in Poughkeepsie.
Okay. Okay. And you guys want to share about how they've been communicating with both staff and community?
I can. This is Sarah Ugolini from the Red Hook Community Center.
Hi, Sarah.
Hi. So to kind of answer both your questions, we went hybrid essentially. And so we have programming in person and virtually. So that required us to, one, keep our in-person space very safe. So we've, lots of PPE, obviously, and we've gone way kind of, it also it required us to really up our virtual game. So we took.
I think Sarah froze up on us. I'm gonna give her like another second, see if she can unfreeze. Okay.
This time to create.
Sarah, you keep freezing on us. Sarah, I'm going to ask you to put your stuff in the chat because you keep freezing on us. So I'm looking at
Create a new website.
Okay. Sarah, I'm going to ask you to put your stuff in the chat because you keep freezing. There you go. Thank you. So Andrea says they pivoted to virtual programming and they communicate with their wonderful volunteers, high school and college students. Okay, great. So this is a quick plug because I'm a grant writer, which I don't really do anymore. But I would suggest to all of you who had to make some quick exits out of your organizations and do all this home-based work, don't be afraid to go to some of your local funders like your banks and credit unions and businesses. And if you need to update your technology, please ask for that. And I don't know who your internet provider is in the area. I know up here, I'm in upstate New York, it's Spectrum, but they do have some grants that come, I want to say, I think maybe summer around technology. So keep an eye out for that, but don't be afraid to ask people for that because we're going to be in this world for a little bit longer. And if you need to update your technology as an organization, please do so. All right, I'm going to skip this last question because I think we'll just, if you want to answer, just put it in the chat. Can we go to the next slide, Emily? So why do people volunteer? And I pulled this from Volunteer Pro. And so people volunteer for lots of reasons, right? They volunteer because it aligns with their values. They see it as a way of building their skills, building these social connections and that kind of thing. And what I will say to you is that 42% of people who volunteer because they seek your organization out. And 25% volunteer because they're approached by your organization. Those are usually like your board and committee members and things like that. So I want you guys to think about all the people who work the polls during elections, who canvass for signatures, all the folks who got involved in peaceful protest this last year, those folks all volunteered around things that were important to them, around their passion. So if you have folks who have, like Black Lives Matter signs in their yard, or they have signs in their yard around, slow down children in this area, they are actually identifying to you guys as organizations the things that they care about. So pay attention to stuff like that, because those are folks you want to be thinking about. I see Betty Jones on Oak Street always has these signs in her yards about different things. She might be a great person to connect with and volunteer. So who are we involved with internally in our organization that may already be connected to like that, the Betty Joneses? Okay, so right now we are estimating about 12.6 million. Thank you, Crazy Cat Lady. I am too a crazy cat lady, and I'm surprised they're actually not all over my desk right now. Currently there are about 12.6 million people who are unemployed in America. Some of those folks are still actively looking for jobs. Some of them are close to retirement, and they're just kind of like, well, you know what? I might as well just do early retirement and go out now. And some of them are thinking, you know what? I'm going to wait a little while longer before I really start looking again to see what things are going to kind of happen in my community. And so that is a great potential volunteer base, because let's just be clear, we are all a little tired of being at home right about now, just doing our day-to-day kind of things. And a lot of us are on Zoom and doing stuff like that. But there are people out there who are still looking to connect in different kind of ways. And I love what Curtis said about the social media. But Curtis, I will say this to you. I'm like an older person. I have a LinkedIn. I have no Facebook. I think I have an Instagram. I don't remember the password to it. I'm the person who still actually has a landline. And so when I come home in the afternoon, my cell phone is in my purse. I don't even look at it or answer it. I am like, if you want to call me, you want to, call me on my telephone. I still go to my mail slot every day, and I'm excited to get mail, even the circulars from Ollie's, and Costco. So, and we're going to talk about that in a minute. So we need to really think about who our volunteer base is, why people volunteer, what motivates them, but then also how to reach them. Okay. So I'm going to go to the next slide. Oh, I just want to add too, and 15% of people connect to your organization and volunteer because they connect through a relative or a friend. So I found this slide, and I put this slide in because just as we were talking a little while ago, when you are a different age, you think about things differently. Like I just said, I'm a baby boomer. I like going to my mail slot every day. I look at my messages on my landline phone, which I will never give up, And so you have to think about, as you're looking for people to volunteer, as you're looking to think about who even become your donors, how do you respond and reach out to those folks? But you have to know who those folks are. And we're going to talk a little bit around data in a little bit, but this is some just interesting data. So did you know that baby boomers have a 26% volunteer rate? And this what surprised me is that nearly 3 out of 4 millennials ages 25 through 34 actually donated during the pandemic. 64% of all Americans have made some type of donation since the start of the pandemic. That's a lot of people who realized that there was a real need in their communities and they made donations. And then going back to and I have the list here, so I'm flipping back and forth between my papers. What Jacqueline was saying earlier about that social connection, the Journal of Happiness study says that 1/3 of Americans, once again, are experiencing symptoms of anxiety and depression, but that volunteerism actually boosts mental health. And that's because, it's about connecting with people. And so I want you guys to all think about that, while you're thinking about volunteerism in terms of, how does this help the agency? Also think about how volunteerism for your agency helps the actual volunteers that come into your organization. Okay, because and that's going to and kind of put this in your parking lot, because that's going to kind of drive how you develop content and reach out to folks as you want to bring them in as volunteers. And remember this too, because this is really important. Most volunteers also donate to the organizations that they volunteer for. And most people who become donors to organizations come through do so because they're connected with somebody who is connected to your agency, either as staff or volunteer. Okay, Miss Emily, can we go to the next slide? So what should we be doing now? I know some of you don't have the hand function, but you can use an emotion emoji. I would love to know how many of you during the pandemic actually created a volunteer management program. And Emily, I don't know if you can help me see some of that, because I can't. Let me see if I can come off speaker view for a second. Nope, I can't. I don't know what I'm doing. So how many do we, Emily, can you tell me how many raised hands that we have? Or emoji signs that tell us how many folks had created a volunteer program or?
So this is Naisha Gibbs from Duchess Outreach. I don't know if you could see my hand raised, but I work at Duchess Outreach as the manager of volunteers, and I did not type up a plan, but it was a mental plan that we had to immediately adjust to at the start of COVID. So we had to really address the needs that we had here. We were providing meals in our lunchbox as well as still operating our food pantry, and we did not shut down. So in order to kind of remain safe as volunteers, as a lot of volunteers started to pull out at that time, we were able to say, well, hey, we only need a few volunteers because we wanted to be safe, keep not only our volunteers safe, but our employees safe. So we realized that we had to assess the program, figure out how many volunteers we needed, and only keep those volunteers that were willing to stay with us. And it was amazing to see how many people stayed committed throughout COVID with us. And again, to your point of volunteers being there not only to assist us, but also for them. And they just kept plugging along, and we just kept reassuring them that we were keeping each other safe. And the volunteers have just been incredible. And what surprised me the most about all of this is the number of people that remained with us and the number of people, although we are not accepting volunteers right now, but there are a large number of people that are still looking to volunteer with us.
So I would, if there are people who are looking to volunteer with you guys and you can't use them right now, one of the things I want you guys to think about is to think about maybe how those volunteers can be shared with others. I mean, if you can't use them right now and they really want to get involved, you know, then connect with folks who are sitting in this room right now. And maybe Melissa and Emily, I don't know if you guys are going to create a contact list for all the presenters who are on. But listen, I am a firm believer in abundance. I'm never one of these folks who think that there's not enough. And I always believe if your hands are open to give, your hands are open to receive. And so if you have folks who are calling you and coming through your doors and saying, you know, we want to do something and you can't utilize them right now, then send them to your colleagues. You know, that way the folks are being connected and they're staying busy. And let me tell you something, you are actually building goodwill for yourself as an organization. You're building goodwill in your communities with the volunteers, and you're building goodwill with your colleagues, because you know what, at this point, we are all in this freaking COVID pandemic, kofefe or kofifi together. So, you know, and so we might as well leverage it and make the best use of it. And so if you see me looking down, it's because Melissa thank you, Melissa, sent me a list of all the people who enrolled today. So I'm actually looking at your names and your agencies and making notes on that so as well. So one of the other things that folks know about me when I do these presentations is I am a big data person, because data actually helps you become adaptive and agile. And so I also think to myself, I'm sorry, Emily, can we go to the next slide? So no, go back to the previous one. Yes. So I don't know. Nope. One more. This one, yeah. So I don't know how many of you are familiar with Jim Collins from Good to Great, but he is my all-time favorite business author, and I have read that book probably 5 or 6 times over the last 20 years. And he actually did a little monograph specifically for nonprofits. If you have not read that, I also do executive coaching, and the 2 books I always refer to the folks that I coach are From Good to Great by Jim Collins and Ben Horowitz, The Hard Thing About Hard Things. And both of those books really talk about like the decision-making process and what drives that. And I believe that you make decisions from your gut, but I also believe you make decisions with data, because I think your gut kind of frames the numbers, because numbers are just numbers, but your gut helps you kind of figure out like in what context that data should be used. And so I don't know how many of you are using this time right now, but have you been surveying your volunteers? Have you talked to them about like how they're doing through the pandemic? How was, even before the pandemic, how was your experience with us? Do you feel like your skills and your talents were useful? What skills and talents do you have? And this is where you really should be thinking about like an onboarding process, if you don't have one, an onboarding and orientation process for volunteers, because people volunteer and their time is precious. And so they don't want to come and when they get there, they're like, oh, okay. And you're sitting at the desk. No one greets them. No one has anything prepared for them to do. That's how you lose volunteers. And you also always want to do exit interviews with volunteers. And sometimes volunteers don't leave because it was a bad experience. Often volunteers leave because their life situation changes. Our lives are all cyclical. There are times when we have more time than others. And so you want to make sure that you're capturing that information from your volunteers so you can improve the overall volunteer experience for folks who are coming through your doors. It actually also improves your management systems. How are you tracking people? How are you making sure those resources are aligned? How are you making sure that you have enough money in your budget for PPE and other resources that your volunteers may need? Data actually helps drive those decisions, okay? It understands and helps you measure your impact. So for those of you who are grant writers and development people, if you need to do in-kind on a grant application, what's the best thing you can do? You can count those volunteer hours, which the last time I count, I think it was like up to $27 per hour is the average rate for volunteer hours. That's information that should be used in your grant applications. And even if you're just sharing your impact in the community with your board and with the community. We had, 100 volunteers donate, 7,892 hours to these programs in our community. That's good messaging. And we're going to talk about content later. So I'm going to stop here and say this, as I'm trying to also look at the chat. I get so excited about this stuff that I look at my presentation, I'm like, I know I've already moved 4 slides. And so when we go through the slides, you'll see, oh, she just already talked about that, because this stuff is also interconnected. And so I'm kind of like already someplace else, but I'm back here with you guys. So if I'm moving too fast, somebody can just raise their hand, or somebody can, when I do live presentations, I tell people to do this to me, because I get so excited to tell me like to slow down. So don't be afraid to do that. And then, the data actually helps you with your recruitment and retention. And once again, if you can share with people in your community and with your colleagues and with your board about the things that you are doing, those are actually good messaging tools for recruitment of new volunteers. And people like to feel like they're making impact. So that actually helps retain people too. So you need to be sharing that information with people about their experiences, not just internally, but also externally as well. So I see Crazy Cat Lady says she's scared to volunteer now because of COVID. Yes, they're high here in Syracuse, New York. And yes, there are some online opportunities. I think New York State has a volunteer portal. I'm sure that United Way and the 211 also have information about volunteering. And what I'm going to say to you, crazy cat lady, and you know, you and I can probably be really good friends. So is that, you know, you just need to figure out and connect and think about what does that look like to you. So before you reach out to these places, be very clear about how much time you have to volunteer and what kind of things that you like to do, so you can narrow your search, and you can actually help the organization that you connect with, help them build a really good volunteer experience for you, because you know, you've kind of identified what does that look like for you. Now, doesn't mean that you're not open, because somebody might say something to you and you'd be like, oh, I didn't think about that. So also be open to new ideas. Okay, Emily, we're going to go to the next slide. Any questions? I'm looking at the chat. Oh, thank you, Peter.
Haven't
So,
seen too many questions, but just so many great ideas. Thanks, everyone.
oh, yes. And we get, I hope I get copies of the chat later. I do want to go back. You don't have to move the slide, Emily, but I do want to say something about the data real quick. So data provides you with actionable insights. It identifies issues and opportunities. Once again, it helps you manage your resources. So I just want you guys to think about that when you're looking at the data and what kind of data you could collect. And so for those of you who haven't really been doing this might also be a great volunteer opportunity for someone to come in and actually create some surveys and stuff for you, some of the college students or other folks who may have retired and who are looking for something to do. So it might be another volunteer path for you as well. So we're going to go to the next slide, connecting with others. So 88% of all searches are done on Google. So we don't even say, oh, did you search the internet? We just say, hey, did you Google it, right? Like Google is so in our lexicon right now, which is why they're probably trying to break them up as a monopoly, but whatever. So I would encourage all of you to think about, if you haven't set up your little, like, so if you put in, you know, United Way of, if you put in United Way of Dutchess County, what comes up? And so before you don't actually use the real search name, but if you just put in United Way, and so you know the Google search will come up. Usually on the side of that is like a little thing that talks about the business. So we'll say website, directions, and contact, right? If your agency hasn't done that, create your Google business page, because people go to that. That's where people, you know, leave reviews. That's where people leave other kind of information. And you can see like who's coming to your website. And it's another great tool and to collect data about your organization. So, you know, you want to use your current volunteers to, you know, connect with your current clients, volunteers, and other key stakeholders. So, you know, are you using your volunteers to reach out to your clients, making phone calls, sending emails, sending handwritten notes? I belong to a group here in upstate New York called Women of Pearls. And one of the things that we did many, many years ago is that we would go into the nursing homes on Valentine's Day. And now we just have been talking about what does that look like for us? And we're not even sure if we can even take cards over, right? So we've been working with our, you know, nursing home right in our community, one of the ones in our community, to ask them like, so how can we help you guys around volunteer day, you know, around volunteering around Valentine's Day, you know, to connect with residents? Can we, if we do the cards 2 weeks early and you keep them in a plastic bag, you know, will that kill if there's any potential coronavirus on them? I'm on the public library board here, and what we decided to do is not spray all of our books, but if someone returns a book, it falls into a plastic bag. At the end of the day, we tie that plastic bag up, and we know if it sits in that plastic bag for 2 weeks or something, it's supposed to kill the virus, and that means we don't have to, you know, damage the books by spraying any disinfectant on them. Oh, Melissa says we're having a letter writing party next week, right? You know, I mean, one of the things that one of the other things that we do is we have created a Love Your Legislator Day. And so we used to have our legislators come in for coffee and stuff. Well, we can't do that. So we're going to send them like virtual coffee. You know, we're sending them like little bag. We're sending a virtual coffee day, and we're sending them like little bags of coffee beans, you know, to our legislators for Love Our Legislators Days, because we can't have them come in right now. So the other thing is too, I'm thinking, and I haven't heard this, and maybe somebody is doing this, but we've been thinking about maybe recording some audios for people and then just sharing them online on our Facebook or our website, so people can just kind of click into that. And we don't know what the audios will say yet, but I mean, that's just, I think, it's an interesting way to connect with folks. And so those of you who work with small children, maybe you want to read stories. And then if you, I think I saw the Child Care Council on here. Yep, I saw, I don't know if Jen Brown is on the call, but maybe have some of your volunteers record them reading stories to children that you can put on your website. So daycare centers and other people can like click into those and hear that at night, right? Because we have a lot of parents who are on the Zoom. Or a lot of parents who are still, especially some of our low income folks, are still working jobs. They don't have the luxury of not working. And so maybe, you know, the children having access to that non-paid content is helpful. You might also want to have your volunteers create content. So as Curtis was saying, social media is a great way to connect with people. I'm not on social media really. I don't know how to really create content except for what I do with you guys when I'm in person, you know. But if you have some great writers who are volunteers, you know, when's the last time you refreshed your website or any of your other content? So you can have your volunteers do that. I did a presentation for some arts organizations down in New York City a few months ago. And I love that a lot of them were doing online shows. So, you know, for you guys who, even if you're not an arts organization, right? Maybe your staff and your volunteers might want to do an online comedy show or an online art exhibit, stuff like that. I mean, there's a way to get people involved. And I would say this, maybe you have some volunteer podcasters, absolutely. And I would say that if you don't have that expertise in your staff, you know, if you do the survey with your volunteers, you can see what kind of expertise, skills, and talents that those folks are bringing to you. And really at this point, because we're virtual, you guys are you're no longer limited by geographic location. So really in some ways, the benefit of COVID for us is that now the world is our oyster and we can reach audiences that we've never reached before. So for those of you who are in those kind of organizations where you're doing arts and culture, you know, where you were limited by your 200 seat theater, now you can do an online show or reading, and now you can open that up to the world. My women's group recently just did a 4-day vision board workshop weekend. And on our 3rd day, we had a licensed clinical social worker come in, and the title of her topic was self-care in a time of COVID. We had people as far away as Mexico City, you know, who had come in on this call to talk about how to use self-care during COVID. So don't limit your thinking, right? Just think about how you can reach out to all these folks in very different ways. So again, you want to use multiple channels to connect with people. And this is what I'll say to you, and I'm going to talk about it a little bit more later on, but for those of you who are board members on this call, I want to really encourage you guys to really think about, you know, how are you connecting with your staff right now? I am a big proponent of board members should not just show up for a 2-hour meeting once a month and then nobody sees you in the interim. You know, we are all kind of walking through this, and I think it behooves board members to really reach out, not only to the executive director, but to the staff and say, how are you doing? How are our volunteers doing? How can we help you? And likewise, I think it's a good time for staff to say to the board members, we thank you for your volunteerism, because board members are volunteers, and those are relationships that also need to be nurtured. So anything I need to pay attention to in the chat, I don't want to scare you, but I have 2 cups here because I have one is coffee and one is daytime cold medicine. So anything in the chat that I need to pay attention to, or a question I need to answer, because I know I'm moving kind of fast here. So
so good. Just more great ideas.
So I see a couple of hands up, but I don't know if these were hands up from before. So I see Bonnie has their hand up. Naisha, did you put your hand down or is it still up?
My hand is down. I spoke already. Thank you.
Okay, is Bonnie, I see Bonnie's hand is up. Bonnie, do you want to unmute yourself and make a comment, question, or say something?
One of the things that we've done is to try and ease the minds. You're right. We had to survey everyone to find out where they were and what level of comfort they had by being actually on site. We are a community meals program, and we've switched from dining room service to meal grab and goes in the courtyard. And so some people were not really comfortable interacting with the volunteers the way they would have indoors before COVID. And by surveying them, we definitely found the comfort level, and we're able to assign them to a shift that was good for them. So yes, I think you're absolutely right. And it's very important to know where your volunteers are at.
Absolutely, absolutely. Because once again, and it goes back to that previous slide about, creating a good experience for them. I mean, the most valuable thing that we have is our time. And I think if nothing else, as I have lost 7 family members, not all to COVID, but I lost my nephew in a motorcycle accident back in April down in the Baltimore area. And then not being able to, go to his service, not being able to connect with my family in a way where, we were able to grieve. And as I get older, I'm realizing that I cry a lot. So if I just start crying during the presentation, just ignore me because I'm just a crazy old cat lady who cries. But, we're grieving so much about what our lives used to be like. And so I think it's really important as we connect with people, we understand that and we respect that. And I don't want people to ever say, oh, when we get back to normal, because I don't think we ever will get back to normal in a way that we have before. And that's not even just because of the pandemic. And I'm going to diverse 30 seconds here and I'm not going to get political, but when we watch what happened at our Capitol on January 6th, what I saw was a lot of people who were trying to figure out how to get their voices heard in a way that they think that they have not been heard. And I'm not making a judgment call about that in terms of whether I think your philosophies are right or wrong. But I will say violence and that stuff is kind of never the answer. But we live in a country right now where we have a lot of healing to do, both economically. When you have folks who've made $1 gazillion during the pandemic and other folks have lost money. Racially, we saw a lot of the racial justice stuff bubble up again in this country, which has been bubbling up for years. So we have the social economic, we have this racial stuff, we have this pandemic, we saw health disparities. So we are called to do this work right now, and we need to all put our hands to this work. And I think volunteerism is a way that we can make sure that we structure these experiences of folks who really are about making change in their communities. And so how as organizations can you help them do that? And thank you, Crazy Cat Lady, I want you to send me your phone number because you and I need to talk afterwards because you're right. Crying cleanses the soul. So, Emily, I'm gonna let you take me to the next slide. So identifying the need, this goes back to what I was saying at the very beginning with the information that Lenny was sharing with you. What in your community, what in your organization has changed since the pandemic? Are you still serving the same population? Is it still the same? Are you still serving people in a similar location? Do you still need to offer the same services? And that also ties back to the data slide. When is the last time you really had an opportunity to look at this stuff? And I think in some ways, and I said this at the presentation I did for you guys last spring, in some ways, the pandemic has kind of made us kind of slow down. And I'm hoping that we're all kind of taking this time to think about like what happens in our organizations now. You know, is our mission still relevant to the things that we've been doing? Or how do we need to make these pivots or make these changes, right? And so you want to use the data to kind of figure that out. And that's also, the data is also talking to each other as you kind of look at the needs in your community and the things that are going on. So I'm looking to make sure there's any questions or comments. So for one of the things that we realized as I'm on the board of the public library system here in Onondaga County, you know, our libraries closed, right? So, but people were at home more, so people wanted books. And if you're like me, I don't like to read books on my tablet. I don't like Audible books. I like to, you know, I'm the kind of girl who likes to curl up in her big oversized chair with a cup of coffee or tea, you know, and hold a book. And so we decided that what we were going to do is that we were going to do curbside pickup and drop off for books. And so we had to expand that technology because our need changed. So I'm going to make a quick pivot to this. I don't know how many of you have strategic plans. Throw out your 3 to 5 year strategic plans. Life is too crazy. Stuff is turning like this. I mean, for those of you who had to leave your offices and move quickly, who could even remember who had the freaking Facebook login, or where was the checkbook to write checks or pay bills? And how many of you moved to online payment systems like bill.com? Because like everything had to literally change like that. So if you have a 3 to 5 year plan, take it over the next couple, you know, months, weeks, whatever. Look at it. What can you still use? What have you used? And then maybe take that to create like a 12 to 18 month work plan. So you think about, you know, if your agencies are closed right now, what will our agencies look like when we reopen? We'll be able to bring back the same number of staff people. You know, have we adjusted our budgets to include PPE? What HR policies or other policies do we need to change and update because of this? I mean, now is the time to really look at that. And of course you can't do everything at once, but kind of create in this schedule of like, okay, these are the things we need to do now. These are the things we need to do in the next couple months. These are the things that need to happen when we open. Because we're constantly like changing this. And Curtis, I'm saying this to you specifically, but to everybody else out there, don't worry about having an old computer, because literally the technology changes like every 3-4 months. They do that deliberately to keep us buying all this stuff. So, you know, it's no fault of yours, so don't even worry about it. But, you know, those are the kind of things that we have to think about. I mean, if we need to go into, you know, this more long term, will we help our employees pay for their internet bills? Should we be doing that? I mean, these are all the kind of things that we need to be thinking about as we kind of move through this period where we are right now. Will we offer some of that for our volunteers? So you got to identify the need, you know, not only for your services for your clients, but also the services and needs for your volunteers and, you know, also your other internal stakeholders. Questions, comments? You guys are being awfully quiet out there. You're scaring me. You're probably all asleep.
Good morning.
Good morning.
This is Nikki Telesko-Wimberly from Open Arms Transitional Housing in Wappinger Falls. One of the things that I've been shouting out and telling everyone is that yes, it has changed how we operate as in our population. We're a home that takes in women and children in crisis. And mothers, a lot of the shelters, unless you're domestic violence, do not take the mother and the child. They take the mother, and then the Child Protective Services is called, and the children are removed from the parent. And so Open Arms, our goal and our motto has always been to keep the parent and the child together. So with that being said, a lot of our clients came from the hospitals, Vassar Brothers, or wherever they delivered. If they did not have a place to live, we would receive a phone call from the social workers in these locations telling us that the client did not have a place to go upon discharge, and did we have room? CPS would come to us and say, you know, because they were seeing their clients regularly, they were getting visits in-house regularly. They would say, our client has come up and lost their housing. Do you have room? Because now a lot of the turnaround is so quick in the hospitals, social workers are not being available as much as they are in the hospitals. Even in Department of Social Services, they're not seeing their clients as quickly as they would normally. You know, the building would be full every day, all the time. So we would be at full max capacity, and we were looking to expand because of that. Our waiting list.
Right.
Now, we know that they didn't just disappear. These people didn't just go away, but our connection to them has now been interrupted. And so we're finding some of our young ladies are living wherever they can, in vehicles, trying to stay in the Metro North train station unless they're moved, sitting in restaurants or as long as they can. This is, I am not prepared for how to make that adjustment other than word of mouth. And it's devastating. It's devastating because we do have room now, and I am not getting the people in because we're not making the connections.
So Nikisha, am I pronouncing it correctly? So I hope you guys all heard Nikisha on this call. So for those of you who work with this population, you need to be connecting with her and making referrals to her. I do see the crazy cat lady want to know where you're located. So if you can put that into the chat where you're located.
Sure.
And this is why I love this, because once again, the learning and the connection is in the room, right? So you guys have a chance to, Melissa says, put your information in the chat. So we have these opportunities to make these connections, because we just talked about connecting to each other. And while we're talking about this right now in the framework of volunteer management, you know, this also applies once again to us sitting in this room right now. How do we connect each other? We have resources, we have services that we can share with one another to help make our jobs easier. So let's make sure that we're doing that. I would also say to you, Nikisha, this is also a good time for you to press into your board and see what kind of connections your board has to kind of get that information out. And maybe you want to do some kind of Facebook Live post about the needs you're seeing with the folks that you're serving. You might want to connect with some of the businesses who, you know, businesses still are trying, I think, to find a way to have their volunteers, their staff connect during like community service days. And while they may not be able to come out anymore, maybe they can do a blanket or a mitten drive for you or something like that, where they can drop things off to you. So this is where you can sit down with your board and be creative. So I'm going to make another quick pivot because we're not talking about board development per se. But one of the things I've been saying is I've been doing a lot of board work over the past couple of months, is I say to people, are your board acting in a strategic, a prudent, and I can't remember my third one right now, but I've been telling people almost kind of think about your board as two sides of a whole. So on your board, which are those board members who can really work with the organization on kind of stabilizing where they are right now, right? And so how do we just continue to maintain our daily operations, make sure our staff get paid, apply for this next round of PPP, continue to be thought partners and supports for the staff in this organization. But I think the other part of your board should be, as we continue to move through where we are right now, what's that strategic mode that we need to think about where we have to get to? So I think the other part of your board should be doing that work. So once again, if we can fully reopen our doors in 6, 12 months, whatever, what will that look like? Will we have access to the same funding? You know, I'm sure a lot of foundations have pivoted to some, like a lot of emergency funding. You know, will they go back to funding the things that they used to fund? So maybe some of your board members can start to be reaching out to their funders and saying, hey, just want to touch base with you quickly, you know, so, you know, we have this pot of money from you now. You've been funding us for several years. What does that look like in the future? Can you give us any idea? Oh, I got a little echo. So I want organizations to start thinking strategically, and that's also about your volunteers, right? How will you use them in the future, because you can't really use them right now. So I think Anna Marie had her hand up, but she had unmuted herself. So I don't know if you had a question. Nikisha, I'm going to actually lower your hand.
I'm sorry, I did it by accident. I was typing in the chat.
Vonnie, did you have another question, or should I lower your hand? Okay, I'm going to lower hand. Anybody? Oh, Vonnie, did you have a question or a comment?
No, no,
Okay.
I didn't. Sorry.
Okay. Okay. All right. I'm looking at chat. Thank you. So let's go to the next slide, Emily. Thank you. You know, so this goes back to the data piece, you know, improving the volunteer experience. There have been so many great platforms right now where people are offering free training. I don't know how many of you have heard that New York State Department of Labor has collaborated with Coursera. So you can actually get a free Coursera account and actually take access to classes. And I think if you go to the New York State Department of Labor, you can make that connection for folks. And that might even be a great resource for maybe some of your staff that you've had to lay off. And of course, you know, you don't get like a certificate like you're going through an actual program that you matriculate in, but Coursera has great classes on there. I've taken a couple of them and I've learned so much. Udemy is another platform. edX.org is another platform, you know. So what you want to do is you're thinking about your volunteers, and because you've done this survey, this kind of assessment, and not just with your volunteers, but also with your staff. So as you're moving forward through this, what kind of skills will your volunteers need to have? And then how can you help them get access to that? So, you know, so for instance, you may have somebody they're pretty good at writing content because they used to maybe work in an ad agency. They haven't done that in a while, and or a newspaper, so they're used to writing very long content, but they just need a little help adapting to writing shorter content for social media. Udemy has some really great classes on social media marketing and everything like that. I put my son through one of those. He helps me. Well, let me take that back. He doesn't really help me because I can never get him to do what I want him to do when I want him to do it. But that's another conversation offline about, you know, the children that we love so much. But you know, but those are those opportunities that we can provide, you know, for our staff and our volunteers to think about that. This is a great time if you haven't had a chance to ask your board members who are business people. Hey, you know, hey, so-and-so, you know, Joe Smith, who is the president of the bank. Do you guys have any, you know, training and PD coming up for your staff? You know, is it possible for us to get 1 or 2 slots for our staff and our volunteers? You want to make sure that people are getting access to that kind of thing. And those are the kind of things that you want to ask your board members and others to help you with. Because what you think you really want to do is you want to, you know, build the capacity of the agency, but you also want to build the skill competencies of your volunteers and your staff. And I'm a big proponent of Excel. People think they have to go out and buy these really expensive data management programs. You would be amazed at all that you can do with an Excel spreadsheet. So if you don't have anybody proficient in Excel, please, please, please get somebody who's proficient in Excel, because as you're collecting all this data, somebody who's proficient in Excel can quickly group that information together and analyze it and provide you with some really good usable data. Okay, and I'll make sure you guys get all this information about Udemy and Coursera and stuff in the presentation when I send it out. Can we go to the next slide, Emily? So, what are the things in your organization that need attention right now? Can you use somebody to help you with writing or filing and organizing? designing websites and that kind of thing. I mean, those are some kind of quick and dirty things that you can get people to do. And I'm just going to jump here because I actually have another subject. I'm just going to talk about it now. You know, you guys have also heard of micro volunteerism, right? A lot of people say they don't volunteer because they don't have time and they don't want to make a long-term commitment. Make sure that when you're providing your job, you're outlining your volunteer opportunities, that you have opportunities that, you know, only require an hour or two. And make sure you're very clear about that when you're describing that for folks. Because somebody's like, I just want to come in and build a bookshelf. I want to come in and repaint the community room when nobody is there. That's going to take me a Saturday morning. I'm willing to volunteer to do that. I don't really want to do anything long-term, you know. So you have to make sure that you as an organization have a clear ideal of the things that you need as an agency, and then being able to translate that into information that you can put out on your networks about these are the kind of volunteers that we're looking for. This is the time commitment with a brief description of what it is. People want to know what they're signing up for. And so for it to be kind of vague and you not be able to provide people details, that will run people away. Any questions on the busy work? Okay. I'm almost to the end, yay, because I've been talking for a long time. Let's go to the, this is the last slide. So, and we've talked about a lot of this already. So once again, remember that your board members are volunteers and that you really want to engage them around this time. I do a lot of board development, governance and strategic planning work. And the one thing I hear from EDs all the time is my board is not engaged. So this is where I'm getting ready to have this really hard conversation with you. And if it doesn't apply, be like, well, that doesn't apply to us. A lot of time, organizations, EDs, will choose their friends to be on the board, or they will choose people because this person is very well known in the community, and it would be great for this person to be on our board. Why in the heck would you choose somebody to be on your board who already sits on 7 other boards in your community? They're not going to have time for you. They're just not. And so I hear this complaint, well, they're not engaged. Well, you pick somebody who doesn't have time to be engaged with you, right? So I don't know if the United Way or one of the foundation has a program like this, but up here in upstate New York, I worked with the Gifford Foundation, and we started a program called NTL, Nourishing Tomorrow's Leaders. And what we really did was like, we identified people who don't normally get offers to be on a board because they're not the VP of the local utility company or they're not the president of the bank. But these other folks bring other skills and talents to a board, more so than just writing checks. Money is important, and you need board members who can give you access to funding resources, but you also need board members who can help you think about how do you restructure your programs and your services to best serve the people. And so you want to bring in people who have different degrees of thought. And so when I talk about diversifying a board, I'm not just talking about race and ethnicity. I think that's the quick and easy way of looking at something. And if we have one Black person, one Latino, one Asian American, oh, we've done something. Okay, that's fine. But I'm talking about in terms of social economic. I'm talking about in terms of race. I'm talking about in terms of various abilities. You know, you want to find people who will give you different viewpoints about how you do the work that you do. And you want to pick people to be on the board who actually have time to devote to your board. I am a strong proponent in, as a board member, sometimes I just show up at a public library. I just walk through when I could do that and just see. You know, I went into our main branch one time. There were a bunch of kids sitting there playing Nintendo. I have 4 boys. I grew up playing video games. I just jumped right in and started playing Nintendo with them. They didn't need to know I was a board member. I didn't want them to know I was a board member. I just wanted to just hear their conversation and see what they liked about our system, the kind of things that they were doing there, why, how often they came. And that's that kind of informal information that you get as a board member from someone who's connected and involved and really has time for your organization to do that. And so those are the folks that you want to pick. You want people who are going to really be volunteers for your organization. Remember that volunteers become potential donors, right? People like to give money to places that they're already connected to. So, you know, when you're doing your surveys and you're asking your volunteers like about the things that they do, ask them about the other groups that they're connected with. Ask them about what they would like to do, because you want to be able to connect with that. And so when we get into recruitment, where to look, you should be starting immediately right around your current volunteer base. You know, I hear a lot about, you know, we want to diversify in terms of race and ethnicity. Okay, well, so, you know, if I'm the one Black board member, or if I'm the one Latino board member, I don't want to come in the room and be the only one. And I haven't had an onboarding experience. I don't know who else is in the room. No one welcomed me. That's not a good place. I'm not going to most certainly tell my friends, come be on this board with me, or you should think about volunteering with this organization, because my experience is not good, right? People talk about what feels right for them, right? So my women's group is called Women of Pearls. I sometimes wear my t-shirt to the grocery store. We even have a mask with our little logo on it. People will ask me, well, what is that? So, and you guys have heard me, who've been with me before, have heard me also say this. If you don't have an elevator speech for everyone in your organization, everyone on down from the custodian or the maintenance person up to your board president, people should be able to describe what your organization does. Excuse me. I think it's called 2711-9. You have 27 words. You have 27 seconds, 11 words to describe 3 points or something like that. And I'll make sure I get it out to Melissa. But everybody should be able to talk about your organization and what they do in a very concise and clear way. So if nothing else, I'm going to ask you guys to do, if you don't have that little elevator speech for everybody, one of the first things you should do when you get off this website, this webinar today, is have somebody help you guys create that. Because if people are looking for things to do and looking for ways to get involved, and someone comes in and they see your t-shirt or your logo on something, you know, I heard somebody ask about, you know, putting their logo on the 211 website. Okay, so somebody calls you and they say, yeah, I saw your logo on the 211 website. Tell me what you do. And then the person who answers the phone can't describe very quickly what that looks like. You're going to lose that person. If you go to your website and people look and your mission is right there with a couple bulleted points about what you do, people are going to click right away. And for those of you who collect your analytics around people coming to your website, look at how long people are staying on your website. Look at what they're looking on your website. Look at how long people take to click between, you know, your different pages, or if they're just clicking totally away, right? That's all information you can use. That means you're losing people, right? And your content wants to be engaging. You want people to be able to look at it and get through it clearly. Now, I'm an older person. I actually stop and read stuff. I still hold my books. I still have my landline phone, right? You know, these folks are looking, and is your stuff mobile, okay, one of you young folks, what is that, mobile? You know, when you can look at it on your phone. What is that? You know, so you can look at it on your. Thank you, because see, I did not know that, kind of.
I'm not a young person though.
Oh, well, thank you, Bob. I'm glad you're up to date on all this stuff. You know, so yeah, your stuff looks really great on the website. You have somebody design a really great website for you and that kind of thing. But, you know, if somebody's looking at it on their phone or on their tablet, how does it translate? Does it look good on that way? So I know, for instance, for those of you who like use SurveyMonkey, you can actually create it for both mobile app use or also for website use. So if you're looking at it on the phone, you can still continue to, you know, go through a survey and you can still get the full page. So these are the kind of things that you need to be thinking about as you're looking to recruit and retain volunteers. because people are out there looking for opportunities, but you have to be able to connect with folks. And we've already talked about diversifying. So I'm going to do a quick last few things. I think I've already talked about most of this. Going back to your board members, make sure you are outlining your expectations of what the agency needs from your board members. Use these folks as your thought partners. Don't be afraid to be transparent, not only with your board member, but your staff and your volunteers. I think in light of where we are right now, people are looking for ways, people want to know you, they want to trust you, and then they're going to support you, okay? And so I'm a big person on trust and transparency, acting with integrity, okay? You want to make sure you're engaging and communicating with people regularly in different kind of ways. Make sure you have an onboarding program, not just for your volunteers, but also for your board members, which also are your volunteers. If you haven't looked at it lately, look at your insurance policies. How are they covering your volunteers? Make sure that you're accounting for your PPE and your safety stuff. Update any policies that you have to do that. If you are looking for places to recruit, are the schools still doing community projects? They want the students to do community projects. So you're connecting with your local schools. I mean, if you need like a room painted, are you connecting with your local carpenters or painters union? Make sure that when you do have these job descriptions, once again, that you're very clear about what you're asking of people, the time commitment, and that description only needs to really be about a paragraph and thing like that. So I'm at the end of my presentation. You want to go to the last slide, Emily? So Desmond Tutu says, hope is being able to see that there is light despite all the darkness. And so what I want to say to all of you is that as agencies in your community, you guys are all light in the darkness of this pandemic right now for the people that you serve. And I know that your community is very appreciative of that. And so that is all I have to say. So Melissa, I don't know how much time I have, so I don't know if I have time to take a couple of questions or if there's anything in the chat I need to pay attention to. Sure. Anything I didn't answer because I went through everything kind of fast.
Yeah. Perfect. Yeah, that was phenomenal as always. I did have one question in the chat and then I'll see if there's time for one more. One person asked what the best, most effective relationship is between an executive director and their board.
Wow. Wow. Okay, so off the top of my head, I would say one that's built on mutual trust and respect. And I think that comes because people are transparent and they operate with integrity. I am not one of these folks who believe that, okay, this is for the board members. The rest of you can listen in if you want to, but this is for the board folks who are on the call. Your executive director should not be doing your board agendas. That is a function of the board. I think boards put too much work on EDs and staff. You've made a commitment to be on the board and help provide the duty of care, duty of loyalty, and duty of obedience, which are your three fiduciary responsibilities as board members. And so you need to take it upon yourselves to make sure that you understand what's going on your board, what's going on in your organization. That means you're responsible for asking questions. You are responsible for understanding the financials and really what this organization does and the services it provides. For EDs, be transparent. Use your board members as thought partners. Don't hide things from them. Don't say, well, I'm going to tell them about this and not tell them about that. Don't do that. If you really want to build trust with someone, you do that through transparency. If there is not a good relationship between the board president or the board and the ED, then hire a consultant to come in, because usually, and I had that slide in my last presentation, and Melissa, I'll make a note. This always happens, Melissa. I say something and then people are like, well, where is that slide? Because I didn't mean to say this, but I have a slide about when you're working with boards, usually what conflict arises from. And it usually arises from lack of information, lack of trust, fear, and communication. And so sometimes it's just about how do the board and the ED communicate with each other, because they're not clear expectations and they're not really sure how to do that. And I always say to people, this is not a shameless plug for consultants, but it is. Sometimes you guys just need help from someone outside of the situation to help you kind of navigate those relationships. And that's okay. And that's okay. And if you have dead weight on your board, if you have, Bob Smith, who hasn't shown up at a board meeting in the last 6 months, and he hasn't been at all involved during pandemic, use your bylaws that says if you miss more than 3 meetings, get Bob off your board, because he's not helping you. You need people in your board who are going to work. So that was a long way of me answering that question. I hope I did. So yes, absolutely. And that's because we as organizations don't set very clear expectations of what board members should be doing. And boards need to be getting ongoing professional development for boards. I suggest boards annually take an annual board assessment to kind of figure out how they're really operating and understanding their role. And they can use that information as a baseline, and then they can build upon that. As a support center, we use the ICAT assessment. McKinsey used to have a really amazing free board assessment tool, but they no longer offer it. It was phenomenal, and it was free. And you would send a link out to the board members and they would fill it out and come back, and it was phenomenal. But right now we're using the ICAT. So I don't know if we have time for any last questions, or I hope I answered that question.
Perfect. Yes, that was, I think, really enlightening for everybody. There's just tons of positive comments and feedback in the chat box for you, because you're incredible. And you also had a board invitation if you'd like to join one of our Does anyone have one final question they want to?
I don't know who sent that invitation, but can I just tell you, that sounds like a 4-letter word for me, WORK. I'm just...
Beth, this is Jeannie. Thank you so much. You're a wealth of knowledge, and this was so informative, and I really appreciate your time today. Thank you so much.
Thank you. Thank you. Thank you. And you guys can just put questions in the chat. Melissa knows how to reach out to me. And I just want to say thank you to you guys for all the work that you're doing in your organizations. Hang in there. We are going to get through this one way or the other. I'm not sure how yet. But I know that if we stay connected, true to our mission, we continue to love up on each other, we will get through this.
Yeah. Thank you, Babette. As Jeannie said, you're just incredible. We love having you and hope to have you again soon. Thank you so much. And we have lots of requests too for your contact, if you wouldn't mind throwing that in. And I'm going to give you all 6 minutes till 11:40, and we'll move on to our next presentation. Thanks everyone for sticking with us. Go refresh your cup, grab a granola bar or what have you. And thank you again, Babette. You're wonderful. So we're moving into our last professional development workshop, and then afterwards we'll have our United Way meeting. So I'm thrilled to introduce Tracy Gibbons Hunter. She is the Director of Public Policy and Education Fund of New York Navigator Program. She's an active practitioner of restorative justice practices and circle keeping with Dutchess County Mediation Center and Westchester Restorative Justice Center. Tracy has over 20 years experience as an activist and organizer regarding racial justice, women's rights, criminal justice, people's survival, institute survival, and beyond human rights. Tracy has given presentations, mediated, and helped training to private organizations and school districts. So we're really thrilled to welcome her today. Thank you so much, Tracy.
Thank you. Thank you, everybody. It's been a long morning. Try not to keep you too long, but it's definitely should help us be engaged. So it's the name is Anti-Racism. What's that? And the reason why I asked that question is because it seems to be coming up a lot and people are not familiar with this. They're like, what is this about? What is this? I thought I was woke and I'm not woke, and all these new terms people are hearing, and we're like, what is going on? So the world is changing. There's some things that are changing for the better, as we know, and then, with change, things can change and for the worst. So we have to keep our eye out, right? And what's good for one may not necessarily be good for the other. So anti-racism, let's first talk about, the definition. So I want to talk about race so that we understand how race started in America. So in 1640, there were 3 men who were indentured services. 2 were white, 1 was Black. And all 3 of them decided, hey, the American Indian, the indigenous people, are running away from this service because it's brutal and they're not coming back. Let's try it for ourselves. So the 3 of them decided to go off. And so they did, but they got captured in a few days. Upon their return, all 3 of them were punished. The 2 white men were given 40 lashes and they had an additional 4 years added to their 7 years of indentured service. But John Punch, who was the Black man, was told that he was going to get the 40 lashes. And instead of an additional 40 years of indentured service, he got a lifetime of service. So that was the first time that race was caused to affect someone based on their color. Then in 1662, the law came out that said, whether a woman is bonded or free, her child will follow her condition. So by then we knew that Blacks had been brought to the United States, and Black women, if they were slaves, their child now became slaves for a lifetime. And then in 1669, if a slave resisted their master punished them and ultimately killed them, well, then that was not a felony. And then, of course, in 1857, we had the Dred Scott decision. And that decision said that Blacks are not citizens of the United States. So this is how race started here in the United States. Any questions? Let me check where is the chat?
Not so far, Tracy. And I'm happy to kind of let you know as they come up every couple slides or what have you.
Okay, great.
And we did have a request. I don't know if it's possible to do from slideshow to see, we'll be able to see that slide, but if not, no worries.
I think slideshow. I don't want to do a custom.
Present, go to present.
You go from current slide should be good.
Present?
No, click on from current slide.
Oh, I'm sorry. So
back to where you
slideshow. And then you want me to do, where is that?
From current slide to the left.
To the left.
One more over.
One more left.
More.
Oh, I'm sorry. It's your right. It's our left.
It's the right. Okay. Current slide. Okay.
Yes, yeah, perfect. Thank
All
you.
right, there we go. Okay. All right. All right. Okay, so that's just a little history. You guys should know that there were laws that go on and go on and go on, and they still go on to this date. So these are some questions I'd like you guys to answer. Does racism exist? Does racist exist? And do you believe racism is hurting our country? Okay, you want to end the poll? Anybody need any last minutes? Okay, so out of the number of people who took the poll, 100% said racism does exist. And then it says, and they said 100% racism exists. And we had just 1% of the people who took it who said they don't believe that racism hurts our country. Okay, I'm gonna close this down. Thank you, everybody. So that gives me an idea where we're at, how people are feeling about race and racism. And it's important so that we can then talk about how we're going to get to anti-racism. So race is a lie. We are humans and our race should not matter. But we know that race was created by the Europeans, and they created it because of power. They wanted to establish privilege and power. And along with that, they wanted to establish and have control of the labor. We know that race is just a lie, simply because when you cut, no matter what color you are, blood comes out. We all need a heart for our heart to beat. We all need our brain for our brains to function. And that's in all of us. And prejudice. So prejudice is an option. It's an opinion. It's an opinion that one has of something that they perceive as an idea. And yes, everyone can have a prejudice. So the definition of racism is racial prejudice plus power. And so racism is such an attitude and action that's supported by power of the law. So let's go back to John Punch. John Punch was punished because of his race. It was the white man's prejudice of his race, and it was the control of the law that gave them the power to do the punishment that they gave him. So the breakdown of anti-racism. So let's look at that. Anti pretty much means against. It means you're against something, right? You're against a policy, you're against a belief, a theory, party, or a practice. That's what anti means. So race, we just gave the definition of race. So that would mean that if a person is against anti-racism, then therefore they're saying, I don't believe in that lie that is being told about race. And the ism, as we know, is a suffix that's added to the end of other words. So can anyone or people want to put in the chat any other anti words or definitions or philosophies that they've heard or know of? Anti-fascism, that's right. Anti-Semitism, I love that. Yeah, that's anti-war. Yes. Anti-war. Yes. So we understand the anti part. you have the definition of racism. And so now the question is going to be, are you anti-racism or anti-racist, right? So that's going to be the next thing that we go over. But I just wanted to make sure everybody is comfortable with the definition that I gave of racism, and is everybody comfortable with the breakdown of the word of anti-racism? So is there anything anybody wants to share, or concerns, or something that they feel they want to talk about? Anti-establishment, yeah. Anti-social, yeah, anti-socialism, anti-Christ, heard that before. So another poll question is going to come up, and that is white supremacy about power?
And Tracy, all three are coming up, the next three, just so you know.
Oh, okay. So there was 3 other questions, and it is just talking about poverty enough to address racism, and is white privilege about access to money? So we're at 61% of people voting. I'm just waiting to see if there's going to be more people are going to vote, or if we're at the end.
Excuse me, the poll isn't showing up for a lot of people, I don't think. I'm sorry to interrupt.
No, it's okay.
It should be. We're not sure why that's not the case. If you're not seeing the poll for some reason, please just answer in the chat box, and we're sorry for the technical difficulties on our end.
Yeah, and we could just put your comments if you want. So we'll give you guys maybe 1 more minute for those of you who have access to vote to vote.
Oh, and somebody just commented, if you're using Zoom through a browser and not the app, the polls might not show up. So that might be the issue. So again, please just feel free to utilize the chat box.
Yeah. Okay, so I guess can they still answer those questions, or is it done? It stops, or how does it happen, Melissa?
Just let me know when you want me to close it, Tracy.
Oh, okay. I guess you can close it. So Is there, thanks for the results. That's what I was looking for. Okay. So is white supremacy about power? It's absolutely about power. We saw that this month in the beginning of this year. It is about power. It is about control. And it happens to be about white supremacy, wanting power. It's something that they've always had and want to maintain from the existence of this country. So remember, there were Europeans, mainly from England, who were rich, and they funded the servants to come to America and work the land. It began with tobacco, believe it or not with cotton. It originally started with tobacco and rice. And they used the indigenous people that were here. They used slaves, and they used servants that they would pay them for 7 years. And then after their 7 years, they were supposed to get a gun and land to till their own and, you know, support themselves. But that was supported by rich white men from Europe. And they wanted to maintain that power. And in order to maintain that power, they could not let any other race come in and be a part of it. So it is about white supremacy. It is about control. So for some people, I think it was 5% said white supremacy is not about power. That's a conversation you need to have with a broader group to understand why you feel that that's not the case. And I'm not saying that it's 100% not, but I am going to say that history shows us that white supremacy is about power. And even if you look it up, the definition, it is about power. Okay, and so then question number 2 is just talking about poverty enough to address racism? And I think we had like 2% said yes, and 99% said no. So a little bit about this poverty. Whenever I have this conversation, not all the time, but majority of the time we talk, people want to bring in poverty. They want to say, oh, the reason why things are so bad is because people, you know, are poor. Yes. Yes, people are poor. There are a lot of people poor and starving. We see it on TV all the time. Oh, donate to this organization, donate to that organization. And they always show you this little skinny child that's starving, and they tear at your heart, right? But what we also know is that because poverty does not always mean racism. And here's why. Because the color of your skin gives you an advantage that poor people and indigenous people do not have. I remember hearing Oprah say that she went to a country overseas, and she was trying to buy a pocketbook, and the woman looked at her and said, "You can't afford this pocketbook." Not knowing that she was talking to Oprah Winfrey, right? One of the richest women, or richest Black women, however you want to put it. And she's telling her, you can't afford it. So we know that when they look at people, the first thing you see is the person's color, whether they took a tan or used some type of cream to change their color or not. People do look at your color. They look at your facial features. They make stereotypes of you automatically. So it's I don't want people to feel sad or feel you know, like, oh, I'm so sorry this is happening. I want you to say to yourself, I do have this privilege of my skin being white, and I am getting some advantage because of my white skin. And I am going to do everything in my power to make sure that all of us are treated equally. And that's the part about white privilege. So there was a trick question between 2 and 3. I don't know if some people, really caught on to it, but this whole thing about racism, white privilege, they go together along with the poverty. So I just want to know, is there any questions or people want to add stuff that maybe they want me to talk about in?
Do all the questions need to go in the chat, or can we just unmute? I apologize for muting. But...
Oh, well, you already muted, so go ahead. Tell me what your question is.
A comment. I have to say, as an African American man, and I've learned lately, especially at our organization, the Osborne Association, and we look at our upper leadership that is pretty much all white women. And the leadership has done so much good work with talking about racism recently. And one of the things that when we hear the words white privilege, to hear the group of white women that acknowledge there has been a privilege in being white is something that I had to embrace, take in, and just respect and really begin to look closer at. They wasn't saying it, of course, as boasting, but that is just a fact. And for me, I admire those who are brave enough to step up and say, you know what, white privilege does exist. So I appreciate the question and just being able to have this platform to discuss this. So thank you.
Thank you, Malcolm. I have to agree with you. A quick story about me. I was in the corporate world. And I always tell people, when I was coming up, I became assimilated into the white world. At least I thought I was. I thought I was doing everything I was supposed to be doing. I was getting promoted. I was, being told I'm doing a good job. I'm working with all of these Fortune 500 companies. And then I found out that I was not getting paid as much as my white counterparts. I'm like, so why is that? Why are people asking me to be a part of this and to be on their team and I'm not getting paid for it? And that was because I was so into being assimilated into that white world, to trying to be accepted, to accepting this thing about, oh, it's not about color. And it is about color. Because I had all the credentials. I had more credentials. A matter of fact, I got promoted and I had PhDs, people working for me. We were putting in all this fiber optic that you guys are using right now. That's what we were doing. And I was a project manager for many of them, for many of the Fortune 500 companies, but I wasn't getting compensated for the hard work that I was doing. So 2 friends of mine had me take the People's Institute Survival and Beyond Undoing Racism workshop. And I went home crying that day. I went home crying because that's when I realized that I was trying to play a game that I was never going to win. Absolutely never going to win. It didn't matter what I did or how hard I did it or what I did. It just wasn't going to happen. And yes, I became the rebel. I became the Black troublemaker. And sure enough, Tracy, you got to go. But that was okay because it was time for me to go. It was time for me to realize that I had no reason to be there anymore because my effort to assimilate into their world was never going to be. I had to accept that and I had to move on. Did it mean a pay cut? Absolutely. No longer a 6-figure pay cut. No longer a corporate credit card. But those things were stressing me to no end to have them because it didn't really mean anything. So is there anyone else that's sharing anything? I see 4 new ones. Okay. It's always about color. As a person of a color, you have to work twice as hard and less pay. And what did that one say? I can't see it. Oh, there it is. A simulation does not value the uniqueness of the individual. That's right. That's right. I'm pretty sure a lot of you've heard these conversations and these new titles that they're giving people called diversity, inclusion, and equity. So they're just all over there. I just remember when I was in the corporate world, they had this group and it was called diversity. And Ms. Baker talked about that a little bit, right? Like it's not that if you're going to pick, you're trying to get diversity, make sure you're picking somebody who's also going to bring something to the table, not just picking diversity for the sake of picking diversity. I appreciated her saying that very much. And then she also talked about having this on board. So I'm going to put the on board with the inclusion. Are you including these people? Are you just inviting them to the party, but you're not inviting them to dance? You're not listening to them. You're not asking them to participate. You're not asking them how they can participate. So I'm really concerned about all these new titles, even though I have one. It's called the Diversity, Equity, and Inclusion Director. So I really have to make sure that if I'm taking on this responsibility, that I'm making sure that there is some diversity, that there is equity, and that there is inclusion, because we really need to make sure that we're including people that we're inviting into the field. I think Jacqueline Hernandez, she raised her hand. Jacqueline, did you want to come off of mute and say something?
Yes, first I want to thank you for addressing this issue. I think obviously with everything that's happened over the past year, our nation's been polarized when it comes to race issues in such a way that we absolutely need healing from a lot of what has happened. And hopefully, as community advocates, that we can be that light to continue to push people to, it's kind of like what Babette said, pushing people, being the light in the darkness. So we continue those efforts. I just find it very interesting that you're discussing this. I was invited to become a member of a new foundation in Hudson Valley. Well, it's an existing foundation. I was voted in to be a member. And this morning, right before this meeting, which is why I was rushing from one to the other, I was on their first meeting of the year, and they discussed this particular topic, the diversity, the group, exactly what you termed it. It was the first time I had heard about it. Not the first time I had experience with it. I remember being a student at Colgate University, and this was during a time when they had initiatives to provide students that academically did well, but just didn't have the financial ability to attend an Ivy League school. They provided the HEOP and EOP program. And I recall back then when I was a student that benefited from the EOP program, which is economic opportunity program. It provided students that did well in school just with the opportunity. And it was basically saying, if you gave minority students the ability to have the financial resources to attend the school, that they would perform the same way that their white counterparts would. And I remember it was just Colgate had embraced the program because there was financial incentives that they received. But it was the students that attended this program was really just thrown into the program. There was no transition for it. And they were we were confronted with tons of animosity, because the belief is, you really don't deserve to be here. You're only here because this federal program is pushing for you to be here. And in all reality, you didn't have the money to come here. You really shouldn't be here. And that was like a form of ignorance. So when I think about these new programs that are coming out of this cry for justice, I can't stop but think of that experience I had, in that, you know, you come out and you say, okay, we got to make a change, we got to do something, but there needs to be education as to, you know, and conversations across the tables where people are talking about the hurt that they've experienced, and that acknowledgement that you know, just because my skin is light doesn't mean that I'm a racist, and just because my skin is dark doesn't mean that I'm entitled. That there's real conversation across the table. And I think you know, you talking about this and your experience in the corporate world, I've seen it also. Procter and Gamble, case in point, they had very few minority scientists in that, and the one scientist that was there, she advocated for a program for students, minority students, to get into the program, because she noticed that all the internships only went to Caucasians and it didn't go to any of them. And she said, I can't believe that there are no minority students that fit this tab. And so they allowed her to do the program. And out of that program, I was one of the students that was able to do it. There was probably about 5 of us that became doctors. So, you know, it really made a difference and an impact to have mentors in those positions for the younger people coming up, but to also have people there holding that spot and saying, you know, like you said, you may have been what they considered a token, but you being a token, you opened a door to exposure, to have those conversations, to allow other people to get into that position. So I thank you for doing that, even though I know that was a painful experience. But I think, you know, it is part of the education process. Is, you know, at Colgate, I had tons of debates with students who felt like I took their best friend's spot. And I had to have those conversations with them as to why I believe I deserve to be there. So if we're not there at the table, how can we possibly advocate for true education and elimination of education, of ignorance? Thank you.
Thank you, Jacqueline. I appreciate that. And you're right. You want people, diverse people at the table, but you want them to be heard, right? They have to be heard, you know, when they're at the table. Otherwise, they're just on the menu, and people are going to either eat them up, especially if they're outnumbered. And I can tell you that from experience. you eventually, you know, they take full advantage of you and then move you on, because you don't have what they call allies. And it's, so that's the important thing about these new phrases, is to have the conversations about them. So somebody wrote here that, you know, organizations have expressed equity statements posted on their website. So I love to read organizations' websites when they're posting about diversity, equity, and inclusion. I love to read them. But when you ask them if they're doing it, they don't have an answer for you. So all these corporations and businesses, oh yes, Black lives, oh yes, we're gonna hire this person, we're gonna do that. And the question is, how long is this gonna last? And that is my concern. How long is it gonna last? And is it really, are you really going to make sure that you are doing the definition of what you've posted on your website? Because it's not necessarily equity, is not necessarily money, right? It's different things when it comes to equity. And I just wanted to put that out there, that if your organization is talking about these things, that they really need to talk about it, and they need to figure out how they're going to hold themselves accountable. It's okay to put it on a website, but if you're not holding yourself accountable, that you're meeting, you know, what you need to do, then it's just a statement and it doesn't really mean anything. And your employees look at that, right? They go, oh yeah, we made this big statement. In the meantime, we're still doing the same thing we were doing before.
Can I say something?
Someone wrote, great conversation, promote diversity, should have diversity reflected in their staff and board. I'm all for diversity, but I will tell you that I'm more about inclusion than There's absolute need for diversity. And I will tell you that I remember working with the school and they were like, well, you know, we can't find any Black teachers that want to come. It's like, oh, come on. All these Black kids going to college, you can't find one? You can't find one? Let's rethink that. You know, how hard are you really looking for that person?
Hello,
So
can you hear me? I'm
what
sorry.
else? Somebody wanted to say something. Is that you, Bob? You wanted to share something?
No, this is actually, oh, okay, I'm sorry. I didn't know who
ahead.
you was talking to, I'm sorry.
No.
No, go ahead, Curtis.
Okay, yeah, my camera's terrible. But you said something that was really important also, besides a lot of the other things that you said. You said about being outnumbered. You know, so you can have all the ideas you want, you can do all this diversity, inclusion, and whatever the case may be, but you have 20 white board members, one Latino and one African American, and maybe somebody else. You really don't feel like what you bring to the table is really much of nothing. But then on the lower level of it, when you're in quote unquote management, especially around this time, you feel like some, you know, and I've had these conversations where some people have gotten hired at their jobs through the Black Lives Matter movement and don't want to rock the boat and say too much of anything because they were hired. It's a rarity that you get put in a position like this and you don't want to, little things that you probably would talk about, you really don't want to talk about because again, you just want to keep your job. You don't want to rock the boat. You don't want to be looked at as, listen, I gave you your opportunity. Don't start looking crazy. Don't start acting crazy. Don't start trying to switch stuff around and move things, you know. So there is that dynamic of strength in numbers. When you don't have that strength in numbers, it kind of debilitates how much you really want to go further with what you feel, what you have to say about your organization or anything like that. So, I mean, my organization knows I don't care. So I'm never going to be unprofessional and callous, but I'm going to say how I feel in a respectful manner. You just got to just deal with it. But a lot of other individuals will hold a lot of things inside and things that can actually ruin a program or an organization because they just want to keep their job because of the race they are and that the position that they're in.
So Curtis, I would agree with you 100%. And I would tell you back in the day, I was probably one of those people. I don't know if you guys remember, I told you after I took the Undoing Racism workshop, I came home and I literally got in the bed and cried. And that's because after that workshop, I learned I had to look myself in the mirror and say, Tracy, you're part of this. And how are you going to no longer be a part of this? And they will tell you in the workshop, don't go out there thinking you're going to change this all by yourself because they will get rid of you. They will move you along. If there's a union, they will take you out of the union and give you a management job because now they really have control over you, right? So it is. It's hard for people because you want to advance, you want to do good, you know, you want to get your raise, you want to get your accolades, but you also want to be true to yourself and to your people and to the country. And people can make it very, very difficult. I know Blacks, people have this code that we have to use where you talk a different language when you're around your people than when you're with your corporate world or your business world. I remember when I first started, I used to be designing the phone lines, and I would be talking to Verizon and Southwest, and we would be talking about the design and where we're going to meet, how we're going to meet. And one day I went out there to meet them in person, and every last one of them said to me, Tracy, I never thought you were Black. You sound so white on the phone. So I'm sure some of you have gotten those comments. but that definitely, that happens. It happens to me even till this day. I don't take it bad anymore, but yes, there is code switching. And let me tell you, it hasn't gone away. It's been around for a long, long time. So is there anybody else who wants to add anything? I mean, I think it's really important that we have this back and forth.
Yeah, Tracy, I wanted to say that at our organization, I'm with Hudson Valley Community Services, and one of our primary functions is working with people with HIV and AIDS. And we found that the executive director asked us to form a Black Lives Matter committee to really address the Black Lives Matter issues, as well as diversity. And during the committee, we felt that it was more important not to have anything put on our website. It was more important to address what was going on internally within the agency itself, whether there was internal racism, internalized racism, and in working with our staff and surveying our staff, we found some of the areas that were of the most importance. And we addressed those both in policy and then also in forms that we use when we're meeting with our clients, because a lot of the problems that we were having was racism coming from our clients against members of our organization. So we started to address those, and they've all been put on paper. So every client that comes into our office understands what our values are and how we value diversity and how we will not tolerate language that is offensive. We know that we cannot change their thinking, but their thinking has no place within our agency if it does not respect and value individuals, especially individuals who are perceived as being disadvantaged, whether they are or are not. So we've had African American clients that refuse to work with an African American person because their own internalized feelings was that they weren't going to get the service that they deserved. So we tried to address those issues first. And we believe that if we do the inside job, that it should be able to reflect out.
Thank you, Bob. So I just want to address something that you said. Are you done?
Yes.
Okay, could just mute yourself. Jeffrey, you could unmute, and I just want to say something before you talk. Bob mentioned internalized. So there's internalized oppression, right? And so people of color and Black people, we tend to put ourselves down. We tend to question the other Black person across us. And that's because of the oppression that we've been so assimilated and socialized to believe that this Black person cannot help me. I need the white guy because he's the one, or the white woman. They're the ones that have the power to get what I need. Or we say to ourselves, I'm not good enough for this job. I'm not going to make it. I can't do it. So we are constantly questioning ourselves and questioning the color. So you're right, Bob. There is this thing called internalized oppression, and it's called racial oppression, and Black people definitely have it. And hopefully there's some group out there, and I've always wanted to do this, where Black people get together and talk about our oppressions and how we want to address those. So Jeffrey, you went in the chat, told me you had a question, and somebody else wants to talk about colorism, which I'm okay with. Jeffrey, can you unmute yourself? I don't see you. Maybe I should, there you go.
I'm unmuted, yeah. I don't have a question, I want to make a statement.
Yes, please.
Okay, so as I listened to Jacqueline speak, she struck a chord within me, because I previously worked for an organization where the the leadership of the organization supported you furthering your education. They promoted you climbing higher in the ranks. And so I was enrolled in a program for that. But then what happened, that leadership changed. And the vision of the prior leadership was no longer the vision of the current leadership. And so there were several African-American males who at this time had received their doctorates, and they were never allowed to advance in this organization. You know, there were many others who were not African Americans who did not have their doctorates, who were advanced in this organization, and you know, it just said to me, you know, what a shame that people can be so how can I say, so Black people have to work so much harder, if you will, to receive or to reach the same levels as our counterparts. You know, and it was a bad example to me for those who are coming behind us. Gave them the feeling of, well, if they have reached this level of achievement in education and they can't, you know, receive these positions, then what about me? You know, what hope do I have? You know, I mean, I've since left that organization, but I talk to people from time to time, and it's the same type of thing. So my initial point was, as long as the leadership is promoting it, you know, then you can advance. But if that leadership changes or doesn't promote that, then, you know, no matter how much education you have or no matter how hard you work, you're not going to be promoted. Thank you.
Thank you, Jeffrey. Absolutely, that's out there. That's out here today. So there was somebody who wanted to. They mentioned colorism, and I wonder if that person wants to unmute and speak about it, or do they want me to speak about it?
Hi, Tracy. This is Kadia speaking.
Hi.
The colorism. I just thought of what Bob was saying about the Black person that didn't want a Black staff member at his organization to help the other. And it just made me think of colorism and how, you know, it is a problem in our community. And then you had mentioned getting a group of Black people together to talk about our oppressions, because that's where colorism really stems from. And I just think that overall the conversation is really great, and it's great that the United Way has brought us all together. But we don't have to be the only ones having the conversation here, but it's just so much information, and the work has to continue even after this meeting. But I just want to thank you. And if you want to elaborate on colorism, I don't have an expert spiel. I just figured, you know, since we are talking about anti-racism, that is part of it as well. But thank you so much for everything you're sharing today.
So I would tell you that I am not an expert in any way or form. People, please don't think I'm an expert. I'm not comfortable with this whole thing about experts. I really, you know, I do have a problem with it. You know, if you want, you know, you read the books. I guess those are the experts. I don't consider myself an expert. I would consider myself a person who has lived in the life of a Black woman in a corporate world, in a non-for-profit world, right? In the unemployed world, and has experienced all these things and have conversations with other people about these things, and find it truly interesting how history and people's experiences can educate you so much if you just open your ears and your eyes to it. So the thing I would say about colorism is it's always been. Now, some of us will remember Spike Lee did a movie, I think it was called School Days. And in that movie, the theme was colorism. It was about the colorism amongst Black people, because we are not all the same color. We do not all come from the same place, but we have, unfortunately, been trained and taught and observed and absorbed what white society has taught us, that based on your color, matters where it shouldn't. But the darker you are, the more fearful they are of you. The better your hair is, oh, maybe you're the one, right? So those things that I just wanted to bring up, that I don't want anybody to walk away today feeling bad. So please don't do that. That's not going to help anyone walking away feeling bad. Just take this knowledge and hold on to it. And when you need it, use it. That's what this is supposed to be about. I've seen Black oppression. What is it called? Black oppression. I don't know. You oppress Black people. There's this new thing that they called anti-Blackness. So CCM put that down there. So Black oppression. Yes, there is such a thing as called the Black oppression. And I could tell you another story about that, but I won't. I will just tell you that it is such a thing that Jade has a question. Where are you, Jade? Jade, there you go. You got your hand up. Sorry.
No problem. I'm actually a new DEI intern for United Way at the Dutchess Orange region. And I just had the question of how to enter this space because it is a new committee that has joined, and I'm grateful to be there, but I feel like I don't know, it's a weird position to be an intern and then getting into like the entry level position of it. So when the committee is new and the group might not be that diverse, but they are trying, how can I find my footing and I guess in some ways lead the conversation?
So recently, the NYCLU asked me to be the director, New York State Civil Liberties Union asked me to be the director on the board for their DEI. And at first I was like, I'm not the person for this. But then I decided maybe I am the person for this. Yeah, I'm going to do this. Right. And I'm going to challenge myself. And guess what? When I challenge myself, I'm going to challenge them. But it did mean that I had to reach out to other people that were doing the same thing and find out what were they doing and how were they going about it and how was the board taking it. So Jada, I would say, I'm sorry, Jade, I would say if you don't have anyone to talk to about it, then please reach out to me. Let's have that conversation, right? To put you on footing and that you can hear what others are doing. Because I'm also on these calls with the ACLU, which is the American Civil Liberties Group, and they have all the DEIs from around the state that come on, and those are the conversation. You might have to read some books, you might have to watch some movies, you might have to tell them, and I'm not sure what their goal is for you being part of this committee or what the committee's goal and mission is. So those are things that we could talk about and then come up with, how you want to go about it or how your committee wants to go about it. But I'm definitely here to help. And I'm sure everyone here would love to be a part and to help you with that, because even I am constantly reaching out, right? Constantly reaching out and constantly reading books.
Thank you.
Cecil, is it Cecil?
It's actually Cicely.
Cicely, I'm sorry, Cicely.
That's okay. Yes, good morning. It is. Oh, good afternoon. I have to look because, now we're so global. I have to look at the time. So anyway, it's nice to have these conversations. And anyway, as I mentioned earlier in the chat, that I've also had that discrimination because, as you can hear, people will say, oh, you're not African American, so you don't count. And so these are years of indoctrination in regards to the whole process of why we feel this way towards others. Certainly not for me. Everybody to me matters, and Black lives do matter. And I tell people, look, when Black lives matter, all lives matter. You have to understand that, of course, lives matter, but Black lives have to matter for it all to be inclusive. So basically, it's years of indoctrination. And once the whole thing happens in George Floyd, I connect to my colleagues in the UK, and they decided to have a conversation, have a global conversation about it. And we've been doing it on a consistent basis because it's an ongoing dialogue that needs to happen. So there's that healing, and the healing to go beyond the self-hatred, as it was mentioned, that some people don't even want another Black person to be under them or to advocate for them, because, and it does happen. I mean, that's the truth of the matter. And so it's these things have to be undone. And as I said, we do have these conversations. It's a conversation of healing. So not to so much of the going into the depths of talking about, oh, this and that, because you won't move forward from there. Okay, so that's the story. So how do we move forward from that story? So how do we begin to connect with that story, but yet move forward, because it's happened. So it's important for the healing process to happen. So to mention Jade, yes, Jade, I think that's good. And I have an organization called Inclusive Consortium, and we have many discussions, whether it be mindfulness or discussions about these kinds of things. And Jade, I'm also, I'm going to finish now. I'm also I've been appointed as director for the United States for the International Youth Society. So Jade, I'd like to connect to you because I'd love to have you be a part of we're developing International Youth Society USA. And you and anybody here who has young people, we want to build 52 states we want to represent with the International Youth Society. So thank you, Tracy, and I appreciate you and United, I'm lost for words now. Thank you for putting this together and to have these kinds of conversations, but not to let it stop here. It needs to be an ongoing dialogue. So thank you.
So I couldn't agree with you more. It definitely needs to be an ongoing dialogue. So just quickly, I am going to, white privilege. It's unearned. It's born to benefit white people to receive from the American system, culture, and institutions. And if you are white, you can freely move around without fear. You can shop freely without fear. You can drive, walking, jogging, and breathe without fear. And it had nothing to do with the money you have. And so we're going to talk about racist versus anti-racism. Or anti-racist, sorry. This window I can't see it because it's not side by side. But anyway, so racist, one who is supporting a racist policy through their actions or inactions or expressions of racist ideas. So does anybody have any questions about that? Okay, so now that we know what a racist is, why can't I move this? Okay, so anti-racist is one who is supporting an anti-racist policy through their actions or expressions, an anti-racist idea. An anti-racist idea is any idea that suggests that the racial group are equals in all their apparent differences, that there is nothing right or wrong with any racial group. Anti-racist ideas argue that the racist policies are the cause of racial inequalities or inequities. So I also want to share with you guys that an anti-racist is not someone who's quiet. Because you being quiet at that moment that you're seeing this, then you're saying it's okay to that person to continue to do what they're doing. And let's remember, an a racist policy has to be designed by a racist. Otherwise, it wouldn't be a racist policy. Going back to the original questions that we talked about, is there racism in America? Yes, there is. Is it hurting America? Absolutely. So the question you now have to ask yourself is, can you be an anti-racist? Can you say to those who are writing racist policies or following racist policies, can you say to them, and trust me, I don't want anyone going out there doing this on their own. You make sure you have allies with you. Don't want anyone losing their job or being threatened. You know what? Maybe we need to change that. And here's why. And you need to think it through, because people are just not going to believe it because you told them, right? That's the importance of history. And that's why I started this presentation with some of the original racist laws. Not necessarily, these weren't even policy. These were laws that they wrote. And if you look out through history, they were just on and on and on and on, right? The Lovings, a Black man and a white woman, they wanted, actually, I think they went to jail for a little while, but then they got out and they had to move to Pennsylvania, right? Because they were in Virginia. And these laws were everywhere, right? And those were the Jim Crow laws. I'm just going to check chat to see if anybody wants to share anything. Where is it? Here we go, chat. Okay, all right, okay, we're still going on. So I have this question up. Based on what you've heard so far, I'm all over the place, guys. Kind of got too many screens up. Bear with me. There we go. Hope I don't turn myself off. Okay, so with your thumbs up, ask yourself, can you be a racist and an anti-racist at the same time?
And this poll also asks the America question.
Okay. Oh, you got it in the poll?
Mm-hmm.
Oh, cool. Okay. So guys, go, if you got the poll, answer the question. If you want to put comments, put it in the chat. I would love to hear you guys talk about this question, because it was a question that I was a part of a group and that was asked. And it was like, I don't know, can you be a racist and an anti-racist? That's really interesting. Ah, yeah. And how many words can you make out of the word America? And if anybody wants to type that in chat, I'd love to see what you came up with. Okay, so let's stop the poll and let's have a little talk. So some people posted, let's see, we got here. out of the 67 people who answered, 36 said yes. And 18% said no to the question of, can you be a racist and an anti-racist at the same time? So someone who answered yes, can one of you come off mute for me and tell me how you came up with the answer yes?
So I came up with yes, because I think people who are working to be an anti-racist don't necessarily understand and haven't necessarily really sat with their own biases. They don't necessarily understand their own culture, and they don't necessarily embrace their own culture. So in that sense, I myself can do everything in my power to be an anti-racist, but there may be some thoughts that are so deeply ingrained in me that they just kind of come out at different times. So I think somebody who is an anti-racist and working towards anti-racism, and their intention is to truly be an anti-racist, can still have some racist ideology that they've grown up with, that they may or may not be aware of.
I like that. Anybody else? I think, is that Mo? Mo, do you want to come off of mute and share with us?
Hi, I think I kind of agree somewhat with what Bob said. I think we can work and strive to be anti-racists. I think saying a racist might, I don't know if it's splitting hairs a little bit, but you can act in a way that could be racist without necessarily, I don't know, being a racist. That sounded horrible. That sounded very bad. I'm sorry.
It's okay.
What I'm saying is, like, you can act and you can strive and you can do what you can do to really hope to meet that ideal and to act in that way. But again, as Bob said, I think there are some things that we may not even, and that's privilege coming in, notice or see or understand what we're doing, and we kind of go back into those, well, I don't see color, or I don't, you're just my friend. But these are real things that I think we have to take a look at, and it's tough to parse it out. I think you can be both.
Thank you. I agree with you too. Anybody else who wants to share anything? Anybody who wants to share why they said no?
Oh, sorry. I wanted to share why I said yes.
Oh, please do.
I'm a person that always fought against racism, and I've been in a lot of groups, even as a child, as a teenager. And though you never really think about things like when you go to your own home, your own family, and you hear the comments about other races that you take for granted. You really don't even think that they're racist until you start really looking at it and saying, this is, like, I guess, systemic, because you're raised with these beliefs and you have to actually fight against them. So you need to be able to explain to your own family as well that these are racist ideas that they're talking, and that they need to change their idealism, because if you didn't realize it on your own, then you're just part of the same problem. So I think that's why I said yes.
Okay, thank you. I agree. Anyone else want to share anything regarding that question?
I do.
Yes.
I didn't answer yes because I was like no, and then yesterday I was actually watching a segment where so tough conversation. The people that were at the Capitol riot were obviously white supremacists. Two of them that have been captured are actually married to women of African American descent. And they have like the group the white supremacist group, Proud Boys, I guess it's called, on like tattooed on their arm. And you know, you go on their pictures and they're married to African American women. So I was just so confused because I don't understand it, but I guess you can be. Just I was watching it and I was like, I don't understand. So it's just one of those things where it's like we're like in like a time where I feel like people just don't even know what they really believe, you know? Because if you're willing to marry a woman, provide for her, have a family with her, be with her, how could you go to a riot, you know, trying to give this ideology that, you know, white people are superior? So it just, it didn't make any sense to me. So that was my input. I said no, but then I was watching the segment yesterday and I was like, wait a minute, maybe I should share a little bit about that. But yeah, that's it.
Thank you, Maria. I've had some conversation around that. But before I answer, I think it's Nakisha. Did you have your hand raised?
Yes, I find that, you know, it's easy to discuss, well, it's not easy, but it's a little more understandable to discuss the anti-racism between the opposite races, right? What I find is more common in my circles now, and what I'm coming to understand is the racism within the race, and how a lot of the, you know, we are coming across the upper class, and the division between the upper class and the lower class, as I would say, you know, in our communities, right, which we would consider the lower class. So when my shelter people cannot get their Chromebooks, right, because the kids are now we're learning from home, they were not able to get the Chromebooks in the shelter. And we were calling the schools and telling them, our kids have not yet received their Chromebooks and they're trying to learn on phones, which are limited because they have an Obama phone, or they're using the parent's phone who has the old phones and things like that. But they're noticing that the other students in the upper Arlington area district or other area districts had already received theirs. We're you know, or when we see, you know, well, those are not my friends because they were considered less than this class of people. So, you think you bougie now, or you think you cute now, or you think you got you all that now because you think you in Arlington district now, you know, and that was the racism that they were receiving from their own class of people. So now it's hard for the divide. It's now hard because now they're not just experiencing the racism from the opposite race, they're now experiencing the racism within their own race. And how do you discuss that? How do you discuss that because it's not just about the skin color anymore, it has moved into something of class.
So, are you finished?
Yes, ma'am.
Yeah. Okay. So that's when you get into the racial oppression. That's when the person of color has decided that they are going to assimilate or do their best to assimilate into the white man's society as best that they can, which means, which is what Maria was bringing up, that, oh, I'm going to be on the side of white people. And that's what's happening. That's it's not necessary. I wouldn't necessarily call it racism. What I call it is something that those people are trying to assimilate into the society that told them you got to make money and you got to be in the white world and you've got to adjust yourself to that. And that's what I see a lot of people of color. I met one young lady and she told me, she said, Tracy, I only like white men. And I'm like, oh, you know, that's okay. You get to like whoever you like, as long as you're not putting down black men, right? You're not discriminating against black men. I don't care who you date, marry, just don't be putting down people of color because of their color. You as a black woman cannot do that. Can you put him down because of his personality, because of his language? You know, fine. You know, he's just not the one for you. I get that. But let's not go there because you are not white, right? So I hear you. I definitely hear you, and I could not agree with you more. You're right. I'm not sure if it's colorism there in your example. I would not, because I don't know those people's color, but I do know there is definitely colorism, and there definitely is anti-blackness, and that anti-blackness goes, you know, people that are darker than you, people tend to put them down and treat them differently, even though if they were to go into the same store, they would be treated badly, but they don't see that because they want to put themselves on a pedestal. They want to be better than, and to be better than, the society has taught us, then you find a person of color to put down first.
You're absolutely right. You hit that on the head.
Yep.
That's
the first person you put down, is the person of color. Oh, you froze. Come back. Okay, you froze just a little. Maybe you'll come back. Was there somebody else who wanted to say something? I thought. Melissa, did you see anybody else who had something they wanted to talk? I thought there was somebody.
Was it Curtis?
I would like to say one last thing, and then I'll shut up forever. I find the term race to be part of the problem. The word was started to group people into identifiable groups, which automatically said they're different. And by acknowledging or not acknowledging, by forcing difference, we started to force negative attitudes towards one another. So I find, you know, we don't have another term other than race and anti-race. I mean, racism and anti-racism, but the term race itself just really kind of, I think, is part of the problem. Enough.
No, you're right. It is part of the problem. And that's in the beginning of the presentation. I gave you the history of race and why it was brought in. It was so that they could make a difference, and it was easy to make the difference. So study the history of race, where it came from. 20 more minutes, you guys. We got 20 more minutes. So there was Janine, you wanted to add something? I thought you had unmuted for a minute.
Jeannie? No, I was just saying, I thought it was Curtis had something to say.
Oh, okay.
Yeah.
Curtis, are you gonna?
Yeah, I was, thank you. Yes, can you hear me?
Yeah, we got you.
Can you hear me by any chance?
Yeah.
Yes.
Okay. Okay, so I just want to make sure I got the question correct, because I don't want to answer the question wrong. So was the question, can you be a anti-racist, or can you be a racist and anti-racist at the same time? Was that the question, or? That was the question, right?
It is a trick question. Yep, it's a trick question.
Yeah. No, I just wanted to make sure I read it right and processed it right. Okay. I think at a certain age, we're taught right and wrong. We're at a certain age where we're taught where we can actually read things, look things up. We're in like an extremely the highest information age that you possibly can get to right now. So you have the opportunity to get as much information on as much history as you possibly can. I had a conversation with someone that was white, and as I was listening to him, I had to stop them in the middle of the conversation because, you know, I had told him it's so draining as a Black man. It's draining to have to continue to re-educate people about racism. And I believe that at some point in your life, you get taught whether racism is this and racism is that. But then there's a certain point in your life also where you have to be able to make that decision for yourself, which way you want to go, which way you want to stay. And I think a lot of times what happens is kind of like with the Republicans, and not to get political, some of the individuals in the Republican Party will say, well, you know what, let's not impeach Trump because we want to, you know, bring the country together and not divide it or whatever. But you can't heal unless you address what's the elephant in the room. And I think a lot of times we run around the situations with race when we, and not to say anyone in the group or anything, when we immediately run the Black on Black crime, when we immediately run the we're doing these Black on Black things to ourselves. For me, you know, you're going to be who you are when you're living around who you're living, you know. So, but also you also have the opportunity to make a decision to say, this person did absolutely nothing to me. I don't have nothing against this person. And I believe it's a choice to either rather just be racist or not, because you can educate yourself to be racist or you can educate yourself to not. It's up to the person to choose whether they want to do that or not. That's just my opinion.
Curtis, you're absolutely right. I agree with you 100%. Jacqueline, did you want to share something?
Yeah, I just wanted to comment really quickly. I think there's been so many different perspectives that have been shared, and I think it's so helpful. I think Bob spoke a lot on a lot of different issues that for anybody, you know, when you think there's two different sides, and like was said just now, you know, to be in a position where you're living it on a regular basis, it's your life, it's what you live, you're aware of your color or your cultural background all the time. It stands out, it's what distinguishes you, as Bob says, because it starts with the race. But I just want to kind of acknowledge those individuals that are Caucasian who are actively seeking to educate and to make that change in the community. And I don't know that we say enough to those individuals who really are making a difference, because I know, as you said earlier, that I think a gentleman talked about how there was leadership that believed in educating African American men and helping them to meet the need of the organization. But then when that leadership changed, so did the program. So I just want to acknowledge those people who are in the field, who are actively educating their peers about racism, in regards to, you know, what injustices exist. And I just want to encourage those people that, you know, the people that are doing that, that we think, you know, from a cultural perspective, as a Latina, I thank you for doing that and for making a difference. I thank all the organizations for taking the time out to put these things in place, because you know it's the right thing to do, because you know that there is a such thing as white privilege, and that you're using your, you know, when they say like you have the card, you have the get in, you know, get in or get out of jail card or get in, but you're using your privilege to then open up opportunities for people to level the playing field. So I just want to say thank you to those people on this and in the community who are doing that on a regular basis.
So guys, because we're kind of running out of time, I just want to share, you know, how people can practice being anti-racist. And so, you know, how to be anti-racist. You have Angela Davis. It means hold yourself and others accountable. That's really important. It's really important holding people accountable. Just because you put a statement on a website, or just because you join an organization, or just because you read a book, if you're not holding yourself accountable, then you're going to fall back into those habits. It says keep up with social and political changes that affect target groups. That means reading books, looking at documentaries. I find documentaries very informative for us. Reading all the different books that are out there, and talking to people. Talking to people is very important. You're talking to a human, right? Attend workshops and conferences. Thank you all for attending this and having this conversation. I mean, that's the way we learn and share. We learn terms, how people interpret terms, and how things are going to go forward. And you build community. Believe it or not, we're all now part of a community that's learning something. And hopefully we'll get to do it again to find out where people are at and how far they have gone. So I wanted to share that. And her quote is, in a racist society, it is not enough to be non-racist. You must be anti-racist. So look for this quote, print it out, post it in your desk at home, and always remember to look at it as you go through your day. And so striving to be an anti-racist is an ongoing journey. It is not a box that you can check. It's not something you can say, oh, we had this conversation with Tracy and it was 130 people and I'm good now, right? Or, oh, I read this book and I know everything and I'm good now. Because we know that even the best lawyers go back and pull out their law books and look things over to make sure they're doing it right. And so that's how we're going to have to get through this journey of becoming anti-racist and making America an anti-racist country. And no, we can't get rid of the word race yet because there's too many people who hasn't gotten it yet. But we're working on it, and all of us together are working on it. There's 130 people on this call, and I'm going to say that's a start. That's a big start. And that's the way that we go forward. And so this thing about stop saying I'm not a racist. Yeah. So I know a lot of people, that's the first thing they say, I'm not a racist. It's like, okay, then what are you? I'm an anti-racist. I am striving to be an anti-racist. And if you say or do something that, don't take someone questioning you about it as a negative, take it as an opportunity to learn. And that's what I would share, when you're talking to people. And so, Melissa, I'm at the end. Should we take some more questions? Do we have some? Now, somebody put in, there's a book called Cast. I haven't read the book yet. I plan to. I heard it's a really good book.
Tracy, can I give you a comment?
Yes, Malcolm, you want to say something?
Yeah, I love these conversations, so much appreciate them. Nat Osborne, we've been having this conversation for a few years now. I'm a Black man. My grandparents are those people you spoke about. My grandfather was white, my grandmother was Black, and we lived in Harlem. I remember when my grandfather was the only white man in Harlem, worked in the post office on 35th Street for 50 years, so I was raised, my aunts and uncles are light skinned, so for me, I bring this up because yes, I was always taught that because of people's ignorance that I'm gonna have to work harder. because of the stereotypes. And through trials and tribulations, even today, I fast forward at 48 years old, double master's degrees, you know, very educated. I am in position at my organization of hiring people. My office in Newburgh is primarily staffed with white women, not because it just worked out that way. I teach my 3 boys, you know, not to see color, treat people fairly. We all have opinions on this. You know, working in the prison system for 20 years, I was told a couple days before Christmas, it was behind my back by a white officer. I don't know which one it was, but I was called a inmate nigger lover. And it was those 3 words that crushed me after all of these years of just the word nigger being associated with the work that we do for individuals incarcerated. And I had to make a split decision. And I bring this up because of the Angela Davis quotes. And sure, we got to speak up against things. And I get that. At that moment, I had to make a decision. Do I turn around and address this, or do I live for another day? And I tell you, I chose to live for another day for a lot of reasons. Safety, you know, I need to get back to my family, and I'll process this and deal with this. But at that moment, it was not the time for me to address it. That was my personal opinion. And I tell you, some people, you know, feel that I didn't handle it correctly. I was supposed to turn around, and I was supposed to, you know, really just express how I really felt. And I chose not to. And I'm saying these things because even though my grandfather was a white man, I know racism still exists. I am not naive, and I've raised my sons not to be naive. And I think in organizations, these such conversations need to continue. Uh, there's words that make me feel uncomfortable. People of color. I am a Black man, you know, and it's not to be offensive to nobody. Those things just don't sit well with me. I am a Black man. Why do I have to have, and I know it's politically correct when, you know, we have the terminologies, but my mother and father were Black Panthers. They told me I was a Black man. You're gonna be the next Malcolm X, you know, and now I'm a people of color. And you know, to the African American male, woman, if we do have to work harder, then so be it. Be that person. Get educated. You know, go to school. And be competitive. I sit on boards. I hire people. You know, I'm able to make decisions today, and that's not bragging, but I worked for that. So I believe as a people, we can strive to do whatever we want to do. Maybe we have to work a little harder, but it is possible. And to those who struggling with it, I say don't give up. You know, keep fighting, keep searching for answers. And at the end, you know, God bless everybody. I thank United Way for this here, and you, Tracy, for putting this on. I'm happy I was able to get on here. And I just appreciate everybody who's standing up for right. So thank you.
This is Jeannie. Tracy, thank you so much. And thank you everyone for participating. This was a wonderful discussion, and it needs to continue. These are tough discussions, and sometimes it'll make people feel uncomfortable, but they're conversations we absolutely need to have. So I want to thank you very much. I do have to jump off to go to another meeting, another Zoom meeting. But Melissa, I think you're good for the next session, right? Thank you, everyone, and have a good afternoon. Enjoy the next session as well. Bye.
So guys, I don't see any more questions. So, and anyone else with their hand up. I'm going to thank all of you for participating and the back and forth conversation. I put my contact information in the email. The presentation was only good because all of you participated. So remember that. Remember that your participation in any presentation that is given, especially if the presenter is asking for input, it's to get that dialogue back and forth. And I really do feel like, Melissa, if you want, I could do this on a monthly basis and we could just hear people's stories, because sometimes that is what people need to do in order to heal, is to tell their stories. And I'm more than welcome to set that up and be a part of that. Thank you so much, everybody. Please remember that being an anti-racist and undoing racism is something that you're going to have to practice and do every day. Every day you're going to have to do it. I know it's hard sometimes to call it out when you see it. I understood exactly where Jeffrey was coming from. I've been in that situation. You can't always do it then. And trust me, the frustration and the stress that you go home wanting to know that, saying to yourself, I should have done this and I should have done that. We've all been there. But I would just say racism is like a drug. It's a drug that we have to admit is there, and then we have to do what it needs to take to get rid of it. And that feeling will always come back, but you have to fight it off. And you have to find all the things that are available to you to undo it. Curtis did tell us that you can educate yourself now. You could go to book readings. You could do it with your family, with your friends, by yourself. Call me. It's like just so many other things that you can do to educate yourself and to move forward. So again, thank you, everybody. This was great. Melissa, thanks for inviting me to do this. I put my contact information in there and you guys can just reach out to me anytime.
Thank you, Tracy. That was
Thank you.
incredible, so impactful. I learned so much. Our organization, we're trying to do the work, and we're just so appreciative of you coming today and presenting to so many nonprofits in our community that are working so hard every day to help all the families. And this was just such an important discussion. And like Tracy said, I just really appreciate all of you being so comfortable sharing experiences, sharing your comments. It really just made it such a great dialogue. And I definitely want to continue the dialogue, like Tracy said. So we'll talk offline about what that looks like. So thank you so much. I really, really, truly appreciate it. I'm going to give everyone a 5-minute break, and then we're going to go into our United Way meeting. So I will see you back in 5 minutes. Thank you again, Tracy.
Good.
Before I go into our United Way funding priorities for the upcoming fiscal year, I would like to introduce our Community Impact Committee Chair and Board Member of United Way, Dr. Melissa Gakey.
Hi, everyone. Thank you so much, Melissa. I just wanted to take a few minutes to just thank you for the time and attention and incredible insights that you've shared throughout today's session. I caught into the tail end of what was a very impactful conversation. And I really just want to acknowledge each of you and your organizations that you represent and all of the important work that you do for our area and our region and all of the individuals who live here. And that it's my pleasure to really work closely with a really incredibly committed team on the Community Impact Council, who has the very hard work of sort of sifting through all of this, and you make the work very, very hard, but it's also very meaningful. And so I just want to acknowledge all of you for the commitment and dedication, and really welcome you to this last little bit of your day, and thank you for your involvement and participation.
Thank you so much, Melissa. It's such a pleasure to work with you, and thank you for your years of service and dedication to United Way. So I would now like to introduce our United Way priorities. As you know, 2 years ago, we conducted a comprehensive community-centered strategic planning process, which were reflected in our priorities in our meeting last year, which seems like eons ago now. While the pandemic has began raging, we found that our targeted focus aligned with the needs that were made critical by COVID. As a result, our priorities will remain largely the same, but we will fine-tune our focus at the committee level around food access and crisis intervention, including housing-related needs. We will continue to provide funding for educational programming and discern the effects of the digital divide. I will also provide information and context to the abundant programs we offer year-round to provide capacity and resources to your organizations. Thank you. So I want to thank you so much for coming today, and thank you again to Dr. Gakey. Today we'll go over how to apply for funding and partner organizations requirements. We'll also speak to the added benefits of being a United Way partner. And a reminder for those of you that have not yet said your name, information, organization in the chat box. I know this is my 10th time saying it today, but please do so because we need that for you to receive credit for attending today. We will be looking at our chat box for a point of record to see which organizations were there. And just a reminder, this is a required meeting if you are interested in applying for United Way funding. So if you haven't yet, please go on and do so. If you have already, you don't have to do it again. We'll be looking from the start to finish, but please go on if you have not and just do so. So just name and first name's fine, but just the organization is what we really need. Thank you. We can click through. Great, so our mission statement, we fight for the health, education, and financial stability of every person in our community. And I just want to take a moment to reflect on those who we have lost this year. I hope that each of you are safe and that your families are safe. We all know that we've surpassed 400,000 people that have died in the last year, which is just so tragic and sad and mind-blowing. We were together just about a year ago before we knew any of this was happening. And I just want to take a moment to reflect on those who we've lost. And I also want to thank you for at times risking your lives to deliver critical services to those that maybe were immunocompromised or what have you. You really have kept our community resilient and together. And we thank each of you from the bottom of our hearts. So I would just want to remind you to help us live united. You can use this Live United, hashtag Live United on our social media accounts when referencing our partnership. So what you've all been waiting for are requests for proposals. The link will not go live until February 8th, 2021. You will then have 6 weeks to apply. However, we will not be granting extensions. So please do not wait until the last minute. Inevitably, I receive a lot of calls the day of. We give you 6 weeks and I'm sorry, we do not grant extensions. So I'm saying that twice. So again, just please mark your calendars now. Additionally, we will have a technical guidance PDF online to walk you through applying. We also have an amazing staff person, Rebecca Lull, who's in here somewhere, who is your technical guru and can help during this 6-week time period. All questions should go to ci-inbox@uwdor.org. And Rebecca, maybe if you can put that in the chat box, that would be great. Or Emily, and remind you that I cannot guide you on any content related as I do not make any funding decisions. So if you say, hey, Melissa, I've got this great program idea, I'm going to say, well, go ahead and apply, but I can't tell you if it's good idea, bad idea, if it will receive funding, if it won't receive funding. That's not my job. I facilitate the process, but I do not have a personal aspect in the funding decision. That's because we have 200 grants reviewers, which are amazing community leaders, and probably some of you on this call have been part of our grants review process. And if you haven't, just shoot me an email. Be happy to include you. I still am in the recruiting process for this year. All grant reviewers review about 5 grants using the same evaluation tool. There are community leaders that have been recommended to help with this process, and many have nonprofit or foundation experience. We ensure that you all disclose any potential conflicts and that any nonprofit staff that review cannot evaluate within the category they are applying for funding from, if that makes sense. At that point, we then pull together a panel meeting with each group under education, health, financial stability, and veterans needs. We then have we used to have a face-to-face meeting. Now we have Zoom meetings in which each grant reviewer defends their scores and comments. All scores, comments, and online assessments are then brought to our Community Impact Committee, which is a board subcommittee to allocate dollars and cents. Lastly, the board clarifies information, reviews, and approves these decisions. As it is the community fund, it is the community that makes our funding decisions. And I'm just going to quickly pause. Does anyone have any questions so far in the chat box? And when we send out our documents, these dates will be there. So again, just look out, you'll receive it. If you're signed on our subscription list, you should receive an email inviting you to apply if you're interested on February 8th. And if you're not, it will be on our website. But certainly if you're not, feel free to put your name in the chat box and we'll make sure you get subscribed onto that list. Okay, I'm going to keep going. So the grants review process takes place. Perfect, thanks. The grants review process takes place March through June. At that point, nonprofits are notified by letter of the funding decisions, and those are sent along with their contracts. Given the economic outlook and difficulties some agencies are currently facing, I will additionally schedule a call with each organization's leader before contracts can begin. And this is just a visual look at the process. This year, we have identified the looming housing crisis and hosted a community conversation with close to 150 community members that have participated. So before I go through each one, I want you to be aware these priorities are consistent with those identified by our strategic planning process and rolled out last year. While we are focusing our resources on the following requests for proposals, they will feature additional language that is specific to the pandemic and highlights the resulting and prolonged hunger, the fragility of our housing system, and educational aspects related to the digital divide. Please keep these present issues in mind as you revise your proposals. Additionally, United Way will accept new applications. Last year, the committee made the difficult decision not to consider new to United Way proposals and instead focus our funding into our historically funded programs, especially those that were keeping families housed and fed. So under health, as you'll see, our goal is to increase access to healthy food for families in our community. Families will experience greater food security. That's our outcome. And of course, our goal is to increase access to healthy food for families in our community. Our goal for veterans is program staff and volunteers will increase access to affordable housing and legal services for veterans and their families. And our outcome is increased accessibility to affordable housing and legal support options for veterans. Under financial stability, our goal is to improve access to resources to alleviate short-term financial crisis in order to increase local families' economic position. Our outcome is to increase financial assets for ALICE and low-income individuals. Our goal under education is to increase opportunities for positive youth development and literacy services, and our outcome is that youth will enroll in programs that develop positive behaviors and read proficiently at grade level. Under education, we also have the goal to develop opportunities for lifelong learning to increase skill-based development. And our outcome is to increase families' access to education and workforce training programs. And I'm just gonna pause for a moment because I do have a couple of questions, and please forgive me for my dogs. So we do have one question. Can an organization submit more than one proposal if they are for different programs? Yes, we do have several organizations that do have several programs that receive United Way funding. Often they are in different categories, but we have had some unfunded under the same category. However, generally they have applied under different priority areas. We also have a question. Will United Way fund only previously funded programs this year? We will invite new to United Way organizations to apply. Our committee, our Community Impact Committee has made that commitment. At this time, I do not know how much funding we will have available and what that breakdown looks like, but I can tell you that we will be considering new to United Way applications. What is the grant limit for first-time grantees? That's a great question. Yes, so 10,000 has historically been our grant limit for first-time programs. There has been some discussion about what that looks like in regards to this year, but as of now, that is the decision. And then overall, the limit is 50,000 for a existing program. And let me just check the chat and just see if there's any I missed.
I'm sorry, Melissa, did you say 15,000 or 50?
50, sorry.
50, right?
For historically funded programs, correct.
Thank you.
Okay, I think that's all of them. I'll pause for one more minute. Does anyone else have a question before I continue? Like I said, this is last year's priority document, but we will be putting additional language around the digital divide, around food access, and housing, as those have certainly become vital issues during the pandemic. If a program has existed for some time, does it still count as first time? So a first time program, and I'm sorry, I know in the past sometimes our language has been a little confusing around this. It's a new to United Way program. So if this is the first time receiving funding from United Way, we consider a new to United Way program. Your organization and program may have already existed for 10 years, but if you're applying to United Way and receiving funding for the first time, then it's a new to United Way program. Okay, I'm gonna keep going. Great. So once your organization is selected for funding, these are the expectations. Your organization can expect a site visit, reporting, marketing, listing your organization as a resource, and attending relevant events. For those of you that are currently funded, please ensure you are in compliance with regards to our marketing standards, your logo on our website, your program materials, and social media recognition. Great. So there is significant value added to becoming a United Way partner. You'll have access to year-round volunteers for days of caring, as well as organizational support through our volunteer portal. Also, you may attend our days of sharing and receive material goods to allocate to your clients and participants. You can take part in our community events, such as our recent housing community conversation, or events like today, our nonprofit training, to add capacity to your organization, as well as having abilities to network, especially in this virtually disconnected time. We also have 2 major fundraisers each year, which of course are virtual this year, which will promote awareness of your organization's great work. So if your organization is not selected for funding or you choose not to apply, you can still partake in many of these opportunities. Great, I'm just going to pause. It looks like I have a couple of questions. What about new programs run by historically funded organizations? Yeah, so if it's a new to United Way program, it would still have to, you could apply for up to 10,000 for that specific program. That's a great question. And do you fund smaller organizations? Yes, we do not have a cap on how large or small the organization is. We have some organizations that are just a couple folks and some that are probably 100. So it depends on who is, best meeting that community need and coming up with a community solution that's going to help people under our health education financial stability platforms. And let me just quickly go up and see if there's anything else. Okay, great. I think I'm good. Okay, great. So as you can see, we offer a robust volunteer program offering both ongoing and episodic opportunities. We have a significant volunteer reach and serve as the volunteer center of our region. While these have mainly been virtual, we hope to roll up our sleeves in person soon. As I mentioned earlier, if you have not yet signed up for our 21-day equity challenge, please do so now. And if someone on the team can drop down that link in the chat box to sign up, I know we put it in a couple of times previously, that would be great. The team has done truly an amazing job having 10 mostly virtual MLK month events. Okay, we have a couple more questions. Great, and thanks so much, Dave, for putting that in there. In the past, colleges participated in the workshop and shared their information concerning interns and volunteers. Will they still offer those resources? Yes, that's a great question. So I think that I can definitely find out what some of our contacts are doing. Excuse me one second. I can definitely find out. I think every college is different. Some are operating more remotely, some are somewhat in person. I do think the majority, though, are only having virtual interns. I know that has been our experience. And I don't know, Melissa Gakey, if you want to say anything to that question about what colleges are doing in terms of interns.
Great. Yes, I'm with Marist, so I can speak to how we're helping students get connected. So we're really, encouraging students to, if an organization has a in-person opportunity and they're comfortable having a student come to their organization and work in a socially distant, safe way, as their staff would, considering all of the safety precautions, then students are able to work in person. But many organizations have kind of pivoted to an online or virtual internship, or having some combination of hybrid, so the student does get to work part of their time in person, or in a variety of ways. So I envision that will continue. That'll be how it is in the spring semester, which for Marist begins remotely on February 15th, and then all the students will be back on campus on March 1st. So I know that students really are looking for opportunities to continue their work. So I'd be happy to help anyone on the Zoom get connected into our internship offices for students for the spring and certainly for the summer.
Excellent, thank you so much. And yeah, Marist has been a tremendous partner, and we more often than not have the majority of our interns each semester from Marist. So excellent, thank you so much, Melissa. And we have one person ask our 2 fundraisers. So they are regular fundraisers, just done so in a virtual environment, executed that way. We have our celebration of service event that will be coming up in May or June. We're finalizing the details. And then of course we had our campaign kickoff breakfast this past September. So many of you have probably been to our days of sharing, right? We used to have almost 100 people all at one time in our basement, right? Collecting items that were most essential for the families that they serve. you know, at this point, obviously we can't do that. However, Rebecca Lull has done a phenomenal job pivoting. And so we now have a weekly no contact day of sharing. So if you are interested in selecting goods for the families that you serve, it could be housewares, hygiene items, books, PPE, school supplies, housewares, a lot of different things we offer. You can just send a request of what the items that you need are to Rebecca, and she will put a package together, and then you'll schedule a pickup time. And like I said, it will be contactless. So we've been able to serve almost 10 agencies each week this way. And, you know, some agencies have even preferred it because it is more current in terms of getting the product into families' hands really quickly. So please feel free to schedule your pickup today by emailing Rebecca Lull at rlull@uwdor.org. And Rebecca, if you wanted to add in your email to the chat box, or someone else can, that would be great. And then I have a couple of questions. Melissa, I have live internship positions available. May I have your contact information? Great, yes, you can definitely, I will put my information in the chat box, so we can definitely talk offline. And great, Rebecca had put her email in for donation requests. And great, Melissa put her information. Perfect. I think that was for the other Melissa. That makes sense. Okay, excellent. Let's keep going. Okay, great. Well, you were here earlier, right? We offer nonprofit professional development opportunities twice a year, but there's more. Volunteers through United Way programs can actually receive a 25% discount on tuition at Marist. And like I said, wonderful partner. And staff ed or funded organizations can receive up to a 25% discount at Mount St. Mary College. So we have those ongoing partnerships too, which is wonderful. And as you can see, we've had a lot of past topics. And I will be asking you in my closing remarks to, you know, make sure that you let us know what we can offer next time at our next professional development training, because we decide those topics based on feedback and based on those surveys. So if you want to, you know, share your opinion and your voice, just make sure that you fill out your survey. I promise it'll take no longer than 2 minutes, and get the opportunity to tell us what we should focus on next time. So we've offered a lot in the past, and sometimes we offer things again because they continue to be current or relevant, or what folks are most in need of. So just make sure you give us that feedback. Great. And of course, we have our community conversations that was in the before times, right? And this past October, we had one around housing needs. We hold our community needs assessment each year by inviting community stakeholders to comment on crucial local topics that inform our request for proposal documents. And we invite you to lend your feedback at future sessions. We had about 150 folks at our most recent community conversation around the looming housing crisis. And yes, awareness opportunities. So we have up to 500 people at our biannual fundraisers, and I hope to see you at our upcoming celebration of service. Additionally, we may request that you speak about our partnership at a fundraising campaign, and we still have those meetings on Zoom, believe me. And these opportunities are to promote our shared work. And that's just one of our Day of Caring opportunities that I wanted to throw up there, you know, to kind of reflect on what we're, you know, our now time. Okay, great. And as you can see, by Living United together, we've touched the lives of 240,000 people in the last year. That's 1 in 4 of our neighbors, and that is thanks to you and all of the hard work that you are doing on the front lines, keeping everybody safe, fed, housed, and everything else. And I really, truly appreciate all of your hard work, especially during this really tragic period in our lives. Thank you for everything you have done for folks in our community. Great, so that's my contact information. If anyone has would like to reach out to me, like I said, if there's something I can't answer, I'll just let you know that. I'm very upfront. And if it is a technical question, make sure we get that to CI inbox. And if there's something I can't answer, and maybe it's not about funding or something else, I'd be happy to answer that. I just really look forward to continuing our partnerships and continuing to work with each of you. Does anyone have any final questions for me? I will stay live for a few minutes. If anyone wants to put more questions into the chat box, or if folks want to unmute themselves, that's fine too. And then I just have a couple of closing remarks I'm going to offer in a minute, but I'm just going to pause for one more moment. Thanks everyone for the feedback. Appreciate that. Thank you all so much for being here and spending the majority of your day with us. Okay, Emily, I think we can stop screen sharing and I will go into our closing remarks. Great, thank you so much. So I want to thank you all so much for being here today. As I mentioned, we continue to offer our days of sharing on a weekly basis with clothing, hygiene items, housewares, and more. And make sure you reach out to Rebecca, and we will save the chat because I know there's been so much, wonderful information, and of course, as a point of record for our meeting. If you haven't signed up for our 21-day equity challenge, you still can. And I know that's been shared in the chat a couple of times. If anyone can share it one last time, that would be great. We hope that in 2021, each of us can more diligently commit to the important principles of diversity, equity, inclusion. Our Esprit Task Force meeting takes place on Monday. So Peter, if you can put that in there one more time as well, takes place on Zoom. It's an anti-poverty group focused around Orange County and Newburgh. And we have a listserv of 250 service providers that are dedicated to reducing poverty. And you can email Peter to get on that list. We also have a first-time homebuyers workshop that's coming up on February 24th. More to come. These are always informative and helpful to families in our community, and you can email Yaya to sign up. She does a fabulous job executing those. So those are a few things that are coming up in the short term. And I want to thank you again for attending. I want to thanks to all of our wonderful sponsors. Should any of you have any questions after today, my email is mclark@uwdor.org.